traveling.
Crank up the.
It was this one.
Oh,
But,
yes. Now that you say that, I was like, oh, yeah, I remember now with the cool little fiery sparks
Yes.
things. Yes. All right, that should be good. Herbalist, yay! It's ridiculous. I went back and looked at what they charged us before, and it was like $48 a copy. So if they're this is paid, it'll be less than that.
The quantity.
Yeah, and tell them it's like it's our textbook.
What is that?
All right, me too. Energetic.
Just interesting.
Yeah, so nobody gets to watch me stuff in the pot.
Here's your straw, baby.
And I am long gone whenever you're. You got two people out back.
Did you let them in already?
No, there's two people out back. I didn't let anybody in. I didn't see anybody waiting to get.
By the way, you have a class tonight. Your phone just reminded you.
Mm-hmm.
What email was that?
AccuWorkers.
Oh, my glasses. Oh no.
Can I just show you guys something I ran into today?
Mm-hmm.
Just all by itself. Just hanging out all by
Oh,
itself.
nice.
They're like,
That's
hey, Matt,
beautiful.
is it season for that?
Yeah.
Okay.
Yeah,
good.
they're jumping out of the ground now.
They're so
Yeah, they're great.
they look mean though. They look
Mhm.
like close.
It will tear your hands up.
Yeah, it looks
It is edible, medicinal. You can eat the root on it.
of everything.
Mhm.
The milk
It's not actually, it's a bull thistle, not a milk thistle, but a thistle is a thistle. Mm, 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 mm. You have your volume down.
Yes. Um, um, I cannot shake how tired I am. Like, I don't understand. Non-functional tired. Like exhausted. Like, what happened? It was totally because I got messed up because the puking and the forgetting meaning and stuff.
I assume. Yeah, if you took the German, you don't knock you out.
For a day.
Hmm.
But it makes me exhausted,
Oh,
10 hours later. You want to share my soup or my salad?
mm,
Because I didn't want to. I'm just kidding. I totally didn't.
I know we got like 1 million people supposed to join us online. Hope they make it. Uh-oh, Popo's coming.
We called them.
I know.
I did too. Oh,
I wasn't kidding.
Bob, are you going to tell him about?
oh, like legit. Like, I thought he was
Bob,
joking.
are you going to tell him about the guy also camping the cart out there?
Yeah, it hasn't happened but the one time.
Mm-hmm.
Wow, they're like really packing.
We called him.
But I'm seeing like they have like
I have
Oh, they
to-
always have to.
They always
like
do.
that.
Yeah,
Yeah, my
Is
neighbor
it in
is
Ellis County or that's?
I
No,
don't.
those are-
I don't know a single law enforcement agency that doesn't.
yeah,
The bats?
Yes,
yeah.
every
Oh,
day, all
yeah,
day, 24/7.
yes.
No,
I know that they wear like their guns. and
They
all
live in
that,
fear
but-
base. They have to live that they're going to be
So
attacked
sad,
every
yeah.
single day, and that's why I think it's so difficult for people to realize. I live at my whole family on both sides are first responders, and you don't understand. They're taught from birth that you should be in fear of somebody trying to kill you. Their reactions are overkill because of that. Like we need to teach them differently.
Mhm.
Yeah, like
Like that's all they know, that's it. Everything I'm sure is like a reaction.
the reason why police officers get off so much for convictions is because they did exactly what they were trained to do. I thought people don't understand.
They don't get trained the same way as our military. Our military, they have to actually think before they do stuff. Not all of them, but most of them, that's what they get trained. So when you do embassy work and stuff, you don't get to just do stuff. All those people, they get locked up. But it's all hush hush, nobody knows about it.
We call the cops a lot though.
Here specifically?
Actually, the clinic.
How come? Just,
There's lots of reasons. There's lots of homeless, which we don't care about the homeless, but
She found a serial number.
so like we have this one homeless kid. Or a kid, like he's old enough to be one of my children.
Yeah,
He's a
right.
black kid. He's clearly mentally ill. He's not homeless, that I think his grandmother lives behind
he probably
somewhere.
just goes on his own.
Right. I've seen an older lady assisting him before. I think it's his grandma.
Maddie.
So once in a while I'll go out. He's docile, he's very docile. Shuffles, head down, picks through the garbage. Once in a while I'll go out and he'll be screaming.
Hey, Maddie.
Screaming at the sky, screaming, yelling curses.
Schizophrenic.
And so I call him for that. I'm afraid somebody's gonna hurt him.
Because they're gonna think that he's being like angry towards them.
Right,
Or he's gonna
right.
all of that.
It's a 20-something black kid. He's like a little bit burly. And so I'll call for that because I am afraid he's gonna get killed.
Do they Baker Act him when you call? For something like that? Would they Baker Act or they just
Mm-mm.
take him?
They would help him. They'd help him find his way back home or call them, the grandma. That's the difference. If we call that, like, I'm like, nope, it's not a problem. It's not violent. I'm aware of him. I don't mind him being there. I'm afraid for his safety. His medication is clearly messed up right now. And it usually goes to the end of the month where they run out of funds or medication.
Oh, my, maybe they take a little, or they.
So usually at the end of the month, we have more problems. Hey. And so we'll call for that. We call because people sleep in the back all the time, climb over the fence, sleep in the back.
But are they very respectful of?
No,
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 they're, oh, then that
They're
changes
crazy.
everything. If they were just like, okay, I'm just gonna sleep here for, but if they're.
no, they're
not
batshit crazy.
Oh, oh.
And they're peeing everywhere, pooping on something.
Oh,
So,
no.
And again, I ran a food pantry and a medic thing, like it doesn't bother me at all. My whole life. I've been exposed to that. It doesn't bother me.
And there is good and there is bad, but you know,
Right.
like everything.
But I can't have one of the young girls opening up the back gate and walking into that. So we have to call for that. And there's people that do come in and are very hostile.
You got, how much you get your
Like actual.
pillow?
I was gonna grab two.
Very
I got
hostile.
you.
Thank you. But they're coming to you to ask for help.
Hmm.
So is it that they don't?
That
hear
is
the
their
right answer?
illness.
Oh.
It doesn't matter. We also have people who come in to look at the crystals or to ask for $1 or something. Also very hostile. We have a homeless woman that, I mean, I don't even know if she's homeless. She might just be socially. If the patients don't give it to her, she starts screaming racial stuff at them.
Oh, man.
And she's got a
Or I call the cops on. I don't play with that.
no. And again, I grew up with military and first responders, and so like we've been taught as a whole, like you only call 911 if there's a problem. And
Like that you can't handle, that you can't.
yeah, I don't call every 2 seconds. I don't care. That's what it's for. And all of my family would say they much rather show up where there's no big deal than show up where there's a shooting or something. Like
Yeah.
it's like no, it's they're bored. It's their day.
Right.
Yeah, they're very happy for that to be the case. So, hey, do you want me to carry that back for you?
Oh, no, I can get
You
it.
got it?
Yeah,
Okay.
thank you though.
I just spent a month on crutches. I hate it. We have times where now I've gotten to, I handle it a lot myself, but now I physically escorted people out by their arm. And Bob gets really upset about that. And he's like, come and get one of us. Like, I would throat punch that person in a heartbeat.
Right.
Or I'm the same size that
And they
you
probably
are.
pick up on the energy too, like.
I was gonna
yeah,
say, I'm the size of
They're
the
like,
average
okay, I'm
man.
not gonna mess with you, I got it.
They're in there messing with one of the girls at the front desk. I will walk your ass out and you will have to be in a fight with me. Like I'll fight you. Like it's okay. You punch me, I'm gonna punch you back. And he's like, no, don't do that. And so now I'm just like, Bob,
Yeah, that's. His protective side coming
Oh,
out,
go,
like,
go.
you know, I don't want anybody. to catch on
Safety
you.
Bob.
Yeah,
And,
Yeah.
and so we're lucky we have Safety Bob because he's very trained. Okay,
yeah.
okay, Bob.
It's funny, but I would do the same thing.
That's what I'm saying, because
No,
you
like-
get that like adrenaline, and then afterwards you're like, oh, I probably shouldn't have done that,
Well,
but ooh.
The girl, like there's always just young, like even our boys are young.
Yeah.
And you don't quite know how to handle those kind of things where it's a split second. I am not messing around. That there's not a large line to cross. It's very thin. That the second that you have some kind of posture that's going to be direct and something that would be considered to be adversarial or aggressive,
Yeah.
you don't got to go home, but you can't stay here. Like, I'm so sorry, bye-bye. I said leave.
Yeah.
And I did not stutter. So you need to be walking towards the door. Whatever you're saying to me, it needs to be as you're walking out that door. And I'm usually walking them out with my energy.
That's what I'm saying, like, they
Yeah.
pick up, I'm sure they feel it, like, okay,
Yeah, but it's not smart. And so Bob's right. It's always better just to call.
that's what I'm saying.
Wow,
Afterwards, you're probably
6:30.
like,
All right.
For sure. 6:32.
All right. We'll get started here in like 1 minute while I remember what the heck my name is.
Okay, so hey everybody. It looks like almost everybody. Oh, it is. It's people we know, and so that's good. If you're the first time online with Zoom for us, I'm one of the moderators. People are a little late today, so they're straggling in. My name's Renee. If you don't know,
Florida time.
if you are on, yeah, it is island time, totally. If you are first, you've ever been on Zoom, know that you can unitalk with us at your bottom left-hand corner of your screen. You just take your cursor and unmute the red microphone by your name. If not, I am moderating the chat so that you can send anything to me. It'll be on a slight delay, but I'll say everything that comes through that I can say, like I'll reference it to Bob in some way. So if you feel comfortable just shouting out, do it. I'm putting my chat up right now and it's up and I'm ready to go. And so I'm going to moderate for Bob tonight. So make sure that you get your wishes in for sure. And sorry, I'm eating on screen because I'm technologically illiterate and don't know how to take the video off. So look away. Look away as I chew and talk at the same time.
So,
I will say
and you know what?
I can't get my
That's right.
video off.
I'm trying to, it's like, I don't want to sit in a chair. Chairs are hard.
You want a stool?
Nope. This is what I want.
Can you pull your table closer?
Nope. This is perfect. I think y'all can see me still.
Thank you,
So-
Babsy.
And like you said, I think we know everybody on here, and so I'll spare the propaganda speech, or at least save it till later. I know we got some more people coming on. So this is a weird class, and I think a lot of, like, if you've already been in class, which is a lot of you, it's I kind of told you what it is, and for those of you who have no idea what this class is, but figured what the heck, I'll show up, it's free. Bonus. But this one's a class that I think it was about 6 years ago, maybe 5 or 6 years ago. We were at the AHG conference, American Herbal Skill Conference,
It
and
was a long time. It was probably 6 years.
yeah, and
Mhm.
so Patricia House was on the board of directors and has a Botanologo school up in northern Georgia. She decided she had this great idea for a class that we were going to do during the conference, and she went around and basically sought us out. And I hate to say it,
That's a tell that she came to find us.
well, that I was going to say, unfortunately or fortunately, I'm not sure which, all the board of directors and all the committees there at HG knows, we'll ask Bob, he'll do anything. If you ever come to a conference, that'll make more sense to you later.
We'll talk about anything, anytime, anywhere, has to do with plants or anything.
Yeah, I literally,
UFOs?
I show up at a conference and I go, hey, if anybody no shows, I'm always ready to teach a class.
And we
oh,
just do.
oh, hey,
I've done it too.
whoa, I had my cursor messed up.
Oh
So,
my God.
yeah, we got a ton of people. I will have to do propaganda. So it's like, wow, sorry, y'all. I was didn't see y'all sneak in there. My screen was messed up. So I'll repeat myself since y'all were there and I didn't know it. I thought we were awful light. So at this class, she decided that, and I jumped on the opportunity and I thought it was a brilliant idea. If you've never been to a conference, I don't care whether it's an herbal conference or whatever your profession is and things like that. The folks who get out, who are the lecturers at a conference, they put on their coat and tie, or, in the herb conferences, we put on our sandals. Uh, and we get up there and we're like, we know everything, and everybody sits there. It's like, I'm not worthy, and we're like,
It
I
is
don't get
such
those.
a big joke that it's so pontificating upon
Yes.
the great discoveries that we have
Yeah.
made after thousands of years of herbalism. Yes, we're the ones that discovered echinacea.
Right? Yeah, exactly. And so it's intimidating to especially the newer herbalists, because they're like, well, I don't know, I don't know what they're talking about. I don't know all the Latin names. You're saying all this biochemistry and endocrine stuff. I don't understand. And so the problem is they won't correct you. They will put on this godlike errors. And I think we lose a lot of really good herbalists because of that. And so it was Patricia's idea that we need to stand up and let people know that we've just been doing it a long time. We screwed up a lot. We still occasionally screw up. And the biggest difference is we learn from it. And so we did this panel. There was me and the ND. Oscar, me, and the guy who wrote the book on herb-drug interactions, whose name, Brinker.
It was it?
Yeah,
really?
it was Brinker, yeah. And Oscar was a brand new practitioner who mostly did acupuncture. Brinker is an author and a teacher, but wasn't a practitioner.
Of Herbal Mistake. I mean,
Yeah.
herb-drug interaction.
Yeah. And so they
that was a little intimidating.
Yeah, and so they kind of said, all right, let's kick it off. And we're kind of like, all right, I got lots of stories, no more. And I think Oscar had one story, and Brinker had one story where he tortured his kid and basically put cayenne pepper in his eye by accident. And
it works.
And then I took over for the next 2.5 hours and told 1,000 stories about how I've screwed up over the years. So,
man, I forgot about that.
I thought it was a brilliant class, and I really liked the premise, the idea that let's take us off this peg of superiority and let people recognize that it's okay to make mistakes. It's okay to not know all the answers, and that the whole idea is we know where to go and find the answers, or we learn from our mistakes so that we don't do them 6 or 7 times.
Let me point out real quick that doctors do this all of the time, and that is side effects. They'll give you something that's going to give you a rash or going to make you vomit, and then they'll just say, oh no, that's just part of them taking medicine. Just shut up and take medicine.
Yeah, I got that one coming up.
Yeah.
So my cheat sheet.
My point is that
I had so many screw ups, I had to write it out so I didn't forget any of the good stories.
Oh, it's so good. My point is everybody does I meant to do that. And it's like, no, you didn't.
And I think it's great. So Patricia, I will totally blame this on Patricia that this class even exists. I had so much fun doing it. I think the people who bothered to show up for the class had a lot of fun. And I've actually applied to do this class for the acupuncture conference, for the herbal conferences, and nobody wants to pick it up anymore. So I'm like, screw that, I'm just doing it. And I'm okay to say this because Patricia actually posted it, and I'll start by telling her story. And this happened fairly recently. So she's actually been in practice longer than I have. Her school's been around longer than ours, and she does a lot of wildcrafting. She uses Chinese medicine, but she does more. She does
Thank you.
more Western herbs and medicine making and botany than we do. So less clinical stuff. And so she was out with her class, and they were working in an area in northern Georgia that they've wildcrafted many times before, and everybody was harvesting medicine. And she was harvesting, what was it that she thought she was harvesting?
It was something.
Wild carrot. It was wild carrot that she thought she was harvesting. And she was eating a little bit of it as she went. It had been mowed down, I guess. And
I think it was even more innocent than that. I think she thought it was baby elder.
Maybe.
Like a sprout coming up, like this triangle leaf.
And so as she nibbled on it, she noticed a very distinct sensation in her mouth, and it wasn't a good one. It turns out that it was water hemlock. And water hemlock is a deadly poison.
You know, the hemlock from Shakespeare type of thing.
Yeah. And so she immediately went to the hospital, spent 3 days in the hospitals with all kinds of scary, and she took pictures of herself from the hospital. And so she, and it took a lot of courage, and promise I've poisoned myself many times. We'll be talking about it. It took a lot of courage for her in the moment to say, hey, y'all, don't make this mistake.
It shows what a great teacher and
Yeah.
practitioner she is, that as she was going to the hospital, in the hospital, she was texting
Yeah.
and showing pictures of her in the hospital. Like, look what I just did.
So the reality is we all make mistakes. Only a few of us bother to like show our dirty underwear. So that's kind of the goal of all of this. And I'm not going to do this in the order of all of these.
And so we're going to sit here and talk about how to kind of thwart mistakes, or where you come into this and how this can happen, and what we are going to do about it.
So I was like, where do I start? Which one of these is the most fun of the whole bunch?
I like the.
I'm going to save that one for me. Yeah, I'm going to get to that one. Actually, I'll start with the oldest one. So, a lot of you have heard this story, but I know a few people online probably haven't heard it, so I'm going to torture y'all with it. I've been playing with herbs for way too long. Probably I was about 8-10 years old when I first started playing with herbs, and started with edible wild plants, and then as time went on, I started to learn that they had medicinal benefits. Spent a lot of my teen years living in the Bahamas and learned the Bahamian Caribbean medicine. So when I ended up going to boarding school here in St. Pete at Admiral Farragut, and I was probably my roommate Enrique Zenaletti was from Venezuela. I thought you added another one on there. I found him on Facebook a couple of years ago. We're chatting back and forth, and after a couple of things, it's like, oh, I so remember those first few weeks in school when you're puking your guts out because you had gone and harvested some herbs down on the baseball field.
So number one, safe harvesting practices.
And so, I probably don't have PTSD from 1,000 things because I only remember good things. I just remove all the bad stuff. So I totally didn't remember that happening, but I certainly believed it. And the reality is I had not had formal training in herbal anything at that point. It was all very much from books, self-taught, or one of my mentors down in the Bahamas, No Boodle. And everything was organic because it wasn't that polluted down in the Bahamas yet. And so we didn't think about where we pulled our plants from. You know, when we were talking about plants, we were out on some deserted island, one of the outlying islands. And so the idea that maybe the pesticides, the dyes, the weed killer that spread into the baseline so that, you know, maybe that wasn't the best thing to be eaten. And the reality is, I want to say from that moment on, I was very cautious because I don't remember ever poisoning myself from getting it from a lousy place. And I still I'll pull weeds from a place that's a little suspect sometimes, never for making medicine, but just to demonstrate that, whatever, there's some dog pee on it, it's sterile. And so one of the problems is in our industry, and not to make this an herb drug interaction class, but quality control with plants and where they're harvested from. We did an herb walk here last night, and we were looking at pennywort, and we were comparing that to the go-to cola. And the reality is, a lot of it comes from India or China, and the pennywort in particular grows in swampy, wet areas. So if you have dollarweed or pennywort, same thing, in your yard, you're overwatering, and so China and India are places where the waterways are notoriously less than pristine. And there's this really crappy, disgusting drink that you can buy in the Asian market that's pennywort that I'm going to guess that there's not a high quality control standard on that. It's definitely not organic. So people do harvest from the sewer outlets, and things are laced with heavy metals and pesticides and poop and all kinds of other stuff. And so it's important that we talk about safe harvesting practices, that we get the right plant, that we get it from far enough away from a highway. You know, we don't have lead in our gasoline anymore. We have other creepy things, but up until not that long ago, we could buy leaded or unleaded, back when we had catalytic converters and things like that. okay, it's a long time ago, it was the 80s. But that lead, I guess it's been a really long time since we had catalytic, and nobody knows what that is. But anywhere that was near a roadway where cars regularly went by is full of lead.
Mhm.
And so if we're going off of 275 and harvesting some of those wonderful trees and plants, there's so much medicine that grows along 75, it's ridiculous. But it's all full of lead, probably other creepy things as well. And, if you're getting downstream of the paper mill in, let's just say, the Panhandle, although it might look all naturey there, that's got some toxic chemicals. So where we harvest our medicine, knowing the environment, is so vital for our own safety of where we drink the water, where we harvest our plants, but also super important that, especially if we're making medicine, we're giving people herbal medicine, that we know where it's come from. I'll add to that, for those of you going forward in class, you'll get to smell this bag. I saved it. I'm a Chinese herbalist. All of my herbs come from China, the Chinese herbs. But even for the Western herbalists, most of your herbs are growing in India, in China, and many come from the old Eastern Bloc countries, the old Soviet Union. So that's literally where most herbs in commerce. And yes, there's definitely small organic farms in the US and Canada, but that's a limited supply. It's very small numbers. And I make a point to look at every bag of herbs that come through, open it up when we're about to put it on the shelf, and smell them, taste them if necessary. And I opened up this one bag, and it was from a company we've worked with before. Yeah. I was gonna say, yeah, no, they were a valid company. And I smelled it. I was like, that doesn't smell right. And it was citrus peel. And I was like, here, smell this, see if it's good. That classic sour milk thing. And it took me a
This is
minute.
gross. Here, smell it. Why would you do
Yeah.
that?
But as it turns out, it took me about 2 or 3 more sniffs. It was rat pee.
Yeah, there wasn't a question.
And like, I still have I find it every once in a while, so we show it in class. And like, it still
Still
smells
smells
like
like
rat pee. So there was a lot of rat pee. So that idea that we need to always ensure our plant safety. Luckily, I learned that when I was 15. I didn't have to wait until I, poisoned somebody seriously. Sorry, I'm going to make sure that we got that. Okay, good. We got everything. So,
Get to smell the rat pee.
oh, it's special.
Mhm.
Yeah. And, we live in Florida. If you have an orange, any kind of citrus growing in your yard, go out there at night with a flashlight, you'll see those little red eyes. There's rats. They love citrus. And so if I'm drying citrus on the whole fence, there's probably a horde of rats that are having a good time with that, unless I'm protecting it somehow. So it's an
What do
interest.
do they eat the leaves or?
Oh, they eat the fruit mostly.
Yeah.
They steal all the fruit off the tree.
Yeah, but it just goes to say, like, it's one of the reasons why many of you, if not most of you, have been in the Western class, and I make you guys literally drink and smell and taste and see everything. There's a reason for that. I tell you, it's that organoleptic testing of you have to know what your medicine's supposed to be like, because we just had stuff shipped out to a friend of mine who's an herbalist but doesn't practice, and she got it and she's like, this isn't right, and turned over the bag and it wasn't, and they sold it like it was this herb of commerce, and it was a completely different herb. So if she wouldn't have been able to recognize it, then she wouldn't have been able to know, and that wouldn't have been a costly mistake, but she was having panic attacks and anxiety attacks, and it would not have helped her, and so she would have been sitting there waiting for the help to come, and it wouldn't have done it. So her knowing it was the value.
So I've been married twice before. And so a lot of my bad stories and herbal mistakes, unfortunately, are with my exes. It's not why they divorced me.
You never know.
It's like, it could have gone either way. So very early, I think I was still in my first year of acupuncture school at the time. Yeah. And
You were excited and came home with some knowledge.
yeah, maybe first, second year, something like
Totally
that.
hurt her.
And one of the things that I yell at our students for all the time is don't treat family, right? Your significant other, like if I would say, it's like, if you got a cold, sure, here's some, some elder syrup or something. But the reality is, for us to do a good diagnostics with somebody, it's always a mistake to treat family. You don't want to be trying to understand and hyper analyzing your significant others and so forth. And so I, of course, was breaking my own rule. I don't even know that I had a rule yet. And of course, I was, all about the raw herbs. So we were only using raw herbs. And I was trying to generally make some raw herbs for some underlying conditions. And then all of a sudden, she started to catch a cold, and she was getting sick. So I was like, all right, well, I'm going to just fix everything. So there was like some pain and some digestive issues. And then there was this cold and flu. And so this 35 herb formula that I was like, I can do it. I can do everything. I completely understand this pattern. And there's an idea, and we talk about it in Western herb, but even more so in Chinese herbal medicine, this idea that if we catch a cold or a hot or a damp, right? So we use that term of catching a cold, which is crazy, right? You're like, okay, I got a cold. And so the idea, though, in Chinese medicine is that disease travels on the wind, and it shows up as a evil wind cold or heat and so forth. It attacks through here. And that process of our immune system, we call it the Wei Qi, is doing battle with the Shei Qi, the evil Qi, the wind. And so we try to make people break a sweat, diaphoresis for the Western herbalists. And once you break a sweat, you're fine. You're not sick anymore. And so, great. So she felt great the next morning. I didn't get her to break a sweat though. And I vented the cold through her skin, every skin pore. And so luckily from the neck up, no rash, but every inch of her skin. So whatever that virus, bacteria, fungus was that was causing her to feel sick, I expressed it through every skin pore in her body. But she felt fine. She just didn't look right. She looked like a strawberry. And the reality is, when we start to put formulas together, we're lucky to understand just a classical formula. We always have to select it. Renee's students are great. They've basically had tattooed onto their arms. If there's one thing I can help you with today, what would it be? And that tends to be the focus of a formula, rather than, well, let's worry about your birth trauma, and somebody was mean to you in middle school, and then you had the surgery, and then now you got a headache, and like, oh my God, there's no way. And it is a mistake that a lot of new herbalists make. And luckily, that was the worst outcome. It's not uncommon to get way meaner outcomes than that. And a general rule of thumb that I have learned well is we tend to address acute symptoms and things that are excessive when we have too much, like if you had a fever as opposed to fatigue. That we try to address those things that there's too much of. And I know I got some Chinesey folks on here. So we're going to get rid of stagnation. We're going to get rid of excesses of heat and cold and damp before we tonify. And it doesn't mean we can't make complex formulas and all, but we definitely need to take our time and be careful with these things. There's another one of those. I forget where it was. Oh, well.
It's the ankle problem.
You
want me to find it?
No, that's all right.
You want me to give you choices?
No. I got you.
I have my favorites.
I know. I'm saving those for the end. Although, okay, I'll have one for you. This one's a little bit different. And so, no, I'm as guilty as the next one of treating stuff. Of significant others and so forth. And I seem to remember somebody texting me or calling me.
Oh, yeah, the mugwort.
Yeah. And
I want to tell you something. I'm a very good patient. I did exactly what my doctor said.
And so we all make assumptions about stuff. And
I can tell this story if you want me to, and you want me to tell you what happened.
You go for it.
My view. So back in the day, I used to run and be in charge of and work and teach at big festivals. And I was on my way to a giant 4-day festival that I had a huge role in. And I was on I-4 getting ready to leave before I got onto I-4, which is this huge interstate that's here that's really bad for anything related to driving. And I was having great issues with my cycle with bleeding, and I was going to be gone and out for 4 days.
Specifically, a lot of pain.
A lot of pain. So I called Bob, my friend, who was the great Bob Linde. And I called him and said, look, dude, I'm going out into the woods. I'm on my way. Like, I'm literally packing the car up and this is happening. You got anything to say? Like, can you help me with this? Bob's really good at women's health. It's a forte, digestion and women's health. And he's like, yeah, sure. And what did you say? Just do some mud work.
Well, no, I just said, what herbs you got? Right. And so it's like, she was driving, I was wherever. And I was like, well, what do you got? And she just rattled off a couple things. I was like, no. And she goes, oh, I got some mugwort. I was like, oh, perfect. So mugwort is this great herb, IEA in Chinese. And we use it for a variety of different things, but one of which is a really painful menses where there's a lot of clots and where heat makes it better. So it's a warming herb.
Like heating pads, like
yeah.
we can relate to
So
that.
for somebody who like, oh no, it feels better when I put heat on it. Well, then mugwort's your plant.
Wait, and he said this. Just chuck some in a jar. Just chuck some in a jar, in a mason jar on your way up. Just sip on it.
So the assumption that I made was, she's an herbalist. She'll dose it appropriately. And I had forgotten that Renee is a woman of excess. And if you say a dropper, she does a bottle.
Most of the time I need the bottle.
And so
with several things that happened to it. That not only did I excessively throw handfuls into a jar, it was a liter mason jar, not a quart. So I made a liter of it, and it sat in the car in the direct sun.
Oh, see, I just assumed it was a tincture.
On the way up, seatbelted into the car, steeping and steeping and steeping and steeping, getting stronger and stronger and stronger. As I sat there drinking and drinking nearly a liter of mugwort tea in a day, that was like almost decocted. At that point, I got stuck on I-4. It was important that I was on I-4.
I don't think you made it a whole day with that.
I didn't.
It was an hour or two.
Because as I was sitting there, stuck in traffic, literally at a dead stop, I'm in jeans going out to camp, and my whole lap starts welling up with blood all over my pants, like welling up in through my jeans, where I'm on my phone to the great Bob Linde, the doctor.
Mugwort does increase flow.
What'd you do? What'd you do to me?
So, and I hate to say this, I see other acupuncturists as patients.
Good dosing.
I see students, I see graduates, I have MDs that come see me, chiropractors. And it's really easy to make an assumption that another professional knows exactly what you're thinking or what is the normal dosage. And it's really intimidating when you're working with a peer. And because you're like, well, you don't want to sit there and say, what's your, how do you use it? I don't know. How do you use it? We're all playing coy with the whole thing. So we frequently leave it too open-ended. And especially when somebody goes, well, let's make sure it works. And they take it excessively or don't prepare it the way we thought they were going to prepare it. It can have unique consequences.
So that is interesting, because you probably wouldn't have said to me, and I probably wouldn't have said to you for the same reason, take this much or how much to take. Neither one of us would have said that with that kind of professional.
And it's also right. And it's always a challenge, because it wasn't me sitting there in the apothecary creating the perfect formula, doing it in
grams. Let me see your tongue. It was none of that. I was driving on I-4.
Like, I don't know what you got in the car. And so
I always got mugwort because I'm smudging with it.
And that's very common.
Yeah.
Like, I hate to say it, somebody's my mother was on a cruise in the middle of who knows where and says, I'm catching a cold. What should I do? She doesn't have any herbs with her. She's not an herbalist. And so I was like, call down to the kitchen, to the galley, and have them make this for you. And so, like, that's kind of normal for us to do that a lot. I don't know.
So it's important to understand, even with your own, we just did it this morning with a pharmaceutical, even with an over-the-counter, even with things that we consider to be food, that if you really do believe yourself to be working with somebody and you are considered to be a primary, to understand exactly what you're saying and you're doing, even with something like garlic or sage, like you were telling me about your mom and going down to the kitchen, that I had to do the same thing with that same recipe down to Ecuador with Rogelio before we all got there, including Rosie. And I was like, get the nuns and tell them this, because too much, like if they would have left the garlic in, or they would have done like the nasal wash with garlic, that would have been horrible.
See, I should have added that to the list.
Yeah, that's a good one too. And so just understanding that if you're taking that command role, people believe in you, even if you're not a practitioner, if you're a mom, or if you are in that role of telling somebody what to do in the time that they're feeling sick, you have to be very, very precise and specific. If any of you are in school with me, I have buzzwords for you where I'm like, no, it's 1 teaspoon to 1 tablespoon to 8 ounces of water 3 to 4 times a day. Like I have these things that I drill into your head so that you never have to worry about, if you're worried about it, go with the lesser amount, go with 1 teaspoon 3 times a day, steeped at this time. That's why I do that in the beginning with all of you, so that you have this written into your head to understand. We did it this morning with a pharmaceutical where it was every 3 to 6 hours. How many do you take? I mean, every 4 to 6 hours, make sure it's a 4, and you're going to wake up and it's not going to work right. And so it's be precise in your languaging if you're taking that authoritarian role.
And I'm gonna stop in the middle because I was kind of waiting for everybody to get here. I think we got everybody. We don't have a current class schedule up yet, so we're working on that tomorrow. So I wanted to make sure everybody knew about cool stuff that was coming up. April 15th, which I think is a Thursday class.
It is.
That Renee's teaching
It's the
on,
dream pillows, right?
is making dream pillows, formulating medicinal dream pillows. For our students, we have April 17th, we're doing vitamin and mineral therapies, which is a weekend intensive. We usually end up opening that up to our students in both programs, as well as occasionally if there's somebody who's really interested in learning more about that, we open that up for the public.
Do you want to talk about that even a little?
Vitamin mineral therapy.
We evaluate why you take supplements. We evaluate the languaging on the back, how to assess whether or not you're wasting your money, how to assess whether or not you're having a bad product versus good product. Are you going to react? What's worth it, and how it interacts with all of the medicines, and how to use it as medicine.
And we try to put energetics on the
absolutely
various vitamins and minerals.
Like right now, I use more vitamin C for allergies than I do any over the counter. It works that well, and you have to understand the process of how that works to get it. Yeah.
And Trisha, who I think she's still out there.
Yeah.
So she's got lots of letters after her name and degrees and stuff. And also one of our senior students here, as well as the school administrator. She started teaching in anatomy and physiology classes for the herbalist, and doing it by system and going through on Thursday nights, 2-hour blocks, and just kind of beating it to death. And so, although a lot of people are taking the whole series, it's super appropriate to just jump in for some of them. So like last week or month, it was like terminology. This one coming up is the nervous system. So
do you have a date for that one?
Yes, April 22nd. April 24th, we're doing an herb walk. And it's going to be a weird one. We're going to do it out of the clinic, the office at 2520. And then we'll have a plant sale afterwards. But we're going to do around the Grand Central District and look for the food and medicine that's in like the alleyways and the planters in front of some of the places. There will be some issues about safe harvesting practices there.
And Bob, that's the 24th?
That is the 24th, yes, which is a Saturday. And that's just, it's fun to be able to, like, I know where all the plants are within like a mile radius of our house. And so I literally we drive down the highway, we're like, oh, look, at 70 miles an hour, we can do an herb walk.
I love our in city ones because it shows everybody always thinks there's limitations because they don't have a lot of land. And I'm like, no, your food and medicine is everywhere, and you can take it home and start growing it and slowly clean it out and make it an organic plant eventually.
And then you have April 29th, you have a Beltane class celebration-y thing. April 30th is open forum. So basically it's stump the herbalist for 2 hours. No.
Do you want to explain what open forum is?
Open forum is basically, we open it up. We've actually getting a very international crowd. So it's an opportunity, I don't care what level you're at, to ask questions about Western, Chinese herbal medicine, dietary therapies, energetics, acupuncture, you name it. So we've really, we cover a lot, and then we archive it all on our YouTube channel afterwards. May 1st, most important day, Herb Day. So it's international, I think it is now, Herb Day. So we've got, I don't know, I think we're up to about 15 vendors at this point. We got music back. We've got 2 different musical thingies going on. There'll be weird foods that I cook up, all things herbal. Then all of the senior Western students are presenting classes. And then we'll have a practitioner's tent where senior practitioners are giving free. So there's free lectures all
So
day
it's
for that.
all free. It's classes from morning to night. It's vendors, it's food, it's all that, and it's all centered around the streets and our clinic.
May,
Wandering in and out. Sorry.
May 7th, a Friday, growing medicinal plants in Florida is a free class. So all that stuff you buy at Herb Day, you can figure out what the heck to do with it. May 15th is your last chance to get the Western 101 if you want to go on with foundations. So there still is a very little amount of room left in that class. The next A&P class is endocrine system, May 20th. And then May 22nd, if you already had 101 and you're like, yay, I want to learn everything. Foundation starts on the 22nd, and I'll put a bug in your ear. We're doing a weekend intensive on herbal animal care on June 19th and 20th. And that's open to anybody.
Man.
Sorry, that was my propaganda for the day. I lost my list. There it is. All right, let's go for the fun one on top. So when I first opened up the clinic, we were at 9th and Central. There's like a law office there right now. And great place. We had this all glass front and we had all the herbs displayed just inside there. And so we didn't get a lot of walk-in traffic there buying herbs like we do now, because that wasn't the best neighborhood in town, but it's lovely now. And this couple came in, young Black guys. Excuse me, one was transgender and male to female. And she came in and said, got any herbs? Or started asking questions like, I'd read on the internet that there's herbs that will make my breasts grow. And I was like,
Go fatten them up.
And so she was on hormones, taking estrogen, tried to de-emphasize the male sexual characteristics and emphasize the female ones. And I was like, it will a little bit. You might get a half a bra size, but the second you stop taking the herbs, it goes right back to normal. So like, what's the point? It's easier to just do the hormones. It's more consistent. And then they started asking, well, what other herbs you got for a man's nature? And
So many things we can learn about this experience.
I wasn't sure what that was. And is that, do you need an herb to go to war, to hunt? That seems to be male nature. I don't know. And so I asked a couple times and they just kept giggling and asking that a few different ways. It took me a little while to catch up. I was a little slow that day.
For a man's
But they
nature.
were looking for sexual tonics. And so
sweet.
the one wanted it was a slow day. I didn't have any patience. And so whenever I've got like, I don't feel like doing paperwork, I don't have any patience, I'll sit there and like work the apothecary and answer weird questions. And so it was basically giving an impromptu class on all the herbs that can help with sexual function. And I was like, well, I know you probably read a lot about yohimbe. This is an African herb. I was like, but I don't recommend it. It's really dangerous. Although it works like a champ, it will cause anxiety, increased heart rate, changes in blood pressure, insomnia, like not my idea of a good time. I was like, here's some really safe ones. And after this went on, I must have sat there for 30, 40 minutes and talking to this pair, and they were just hilarious. They had me practically crying. I was like, can we get like $10 worth of yohimbe? I was like, that's the one I said you shouldn't do. No, we want that one. I'm like, all right, whatever. It's on the shelf. What the hell? Buyer beware. And I'm there, and they're about to run their credit card, and they look over to me. And they're like whispering back and forth, and it's like, so this is okay to take with crack, right?
Oh, no.
So let me just say that although I have not tested that nor read research to say that is contraindicated with smoking crack, it is. I'm going to say not a good choice. Crack is hot and yohimbe is hot, and so that's gasoline on a fire. And I literally was like, give me that, get out of here.
You don't do the crack, you won't need the men's nature.
So the problem is although I wasn't giving free medical advice over the counter, and I yell at like, the apothecary folks, I was like, no, we can't give out medical advice. That's like, no, that's why we see people. Every time I have sat there and just kind of like, well, here's a couple of options you could use for some, for insomnia, because, you got circular thinking. I won't do an intake. Every single time I do that, I regret it.
Yeah.
Because literally it's like, well, I'm on chemotherapy. Oh, I'm pregnant. I'm going to go smoke crack right now. And so it's like herbs, just because they're natural does not make them safe. Oleander is deadly poison. It's not safe. And there's a reason why we see our clients. It's the reason why we go over health history. We ask about their prescription medications, whether there's a risk of pregnancy, if they have serious medical conditions where we got to take this crap into account. And the reality is they could go into any health food store. They could go into Walgreens for that matter and buy all kinds of serious, powerful herbs. They do stuff. They're not benign. They fix scary stuff. And so to think that they won't have adverse events, that they couldn't have a negative effect if used inappropriately, is crazy. They will cause things to happen. I'm not quite sure what the crack yohimbe actual outcome is. So luckily I stopped them. And I kind of almost wanted to see what happened. That one. And the other part of that, a man's nature. It's one of the reasons it was a few instances almost identical to that I started doing the free sexual health class, always around Valentine's Day for whatever reason. Seems popular then, I don't know. And the reality is that as a culture, and I don't care, rich, poor, choose it, Eastern European, and blah, blah, blah. Everybody's afraid to talk about sex and parts of our anatomy and its function. And so every culture has their innuendos. And it is invariably, they come in for, and my favorite is there's 50-year-old shoulder, frozen shoulder. So some 56-year-old guy will come in and say, yeah, fix my shoulder. And like, we'll go through a whole intake, asking questions, educate, yeah, he's got anything for a little more pep in my step. I'm not quite the same as I used to be. Like, what the hell? You got knee pain? And the reality is that's the only reason they came in. They didn't give a crap about their shoulder, but they were too embarrassed to say they're coming in for increased sexual function or libido. And the crazy thing is, I want to say 90% of the people who come to me and at some point or another ask for improved sexual function, men in particular, they've never asked their doctor to test their testosterone. And I literally don't know whether it's they're embarrassed, whether it makes them less like John Wayne. I don't know, but the reality is some reason they have to use innuendo. They can't say, I'm having erectile dysfunction. My libido sucks, like whatever. And then we can have a really valid conversation about it. But it's always this roundabout way that we have to guess at their languaging. So for those of you who go on as clinicians, you gotta learn all the slang. and honestly, it just makes you better if you start to recognize some of the innuendos and what it means. And to be able to, and we'll talk about this here later, or a few horrible instances, the idea of poker face.
Mm.
Because we've had people who've taken Viagra, and you ever notice the side effects on the commercial?
Mm-hmm.
Erections lasting more than 4 hours, you should seek medical help.
Mm-hmm.
I've had
That
one
happened.
person come to me because 8 hours later, they were not enjoying that anymore. And for whatever reason, they didn't want to go to the hospital, because that is the right treatment. It's not nice what we do to people for that, but we do use acupuncture for that. It's like popping a balloon. No, I'm just kidding. That's not true. So it's not that, but it is unpleasant what we do. We do really mean points. So the reality is you never know what we're going to be asked to try to deal with. And when it comes to sex, sexuality, there's huge issues. We come from this very puritanical background, whether we're religious or not, that we're afraid to say, penis and vagina. Like, no, those are anatomy. It's elbow
It's
and
like arms.
nose.
Yeah.
Like, what the hell's the difference? So I to this day I make sure in some class or another we make sure that I educate people in all the slang terms. No, I'm just kidding.
That's your top one.
Yep, that's the top one.
What do you think?
Oh, I don't know. Oh, actually, I'm going to tell one about myself then. Like I made fun of everybody else now.
What you got?
So, oops, I gotta let somebody in.
I wish there's a way I could do it for you.
Yeah, they're just jumping over here. So I like to think I know stuff. I'm, Chinese medicine and energetics. We preach that from the rooftop for you. And I still, I have a Western brain. I like medicine, not taking it, but I like the study of Western medicine, anatomy, physiology, pathology. That's cool stuff. And so, although I will sit here and talk about wind heat and wind cold and things like that, and for most of my life, I still think about it's a virus, it's a bacteria, it's a fungus, and so we take vitamin C and we take vitamin D, and those help our immune system to fight these things. And we have formulas like Yin Chow and Andrographis formula that are good antivirals. And so,
Are you doing the energetics matters?
yes.
Okay, thank you.
and the reality is, and somewhere there's pictures of this. This was probably 10 years ago. And it was the last class for the Chinese. So they'd made it through the 2 years. And we had graduation that night after the Sunday class. So, I just taught 2 days straight. I'd seen patients the whole week. And then I had to run home. We were doing graduation at the house. I had to set the fire and I had to stop at Publix and grab some snacks. And I was a little run down, it's a lot of prep. And so I remember so clearly being in Publix, and I had like a sweatshirt on or something. And as I'm checking out of the front counter, I say to the woman, I was like, man, how can you stand it in here? It's so freaking cold. And it was a little chilly out. It wasn't cold. I felt like they had the AC cranked up. And I was like literally shaking as I got in there. And I have immune issues. My sinuses are kicking my butt today, probably because I ate something yummy yesterday. And so I just figured it was like, I'm run down. I ate crap for lunch or something. So that's why I was feeling a little tired. And made it through graduation. And I was like, I hope I'm not catching something. So I took a bunch of vitamin C. I took a bunch of Andrographis and our antiviral herbs that we use in Chinese medicine, because I figured it was a virus. And the pictures, like after at graduation, everybody had their certificates and they're, taking group photos and stuff like that. I'm like, I looked like hell. I was like, oh my God, I'm either drunk or dead or something. And I'm rarely sick for more than 24 hours.
It's a weird thing to watch.
And I woke up in the morning and I thought I'd been hit by a truck, and I actually canceled patients. I never cancel patients. Like, I'd better be dying or my leg broke or something. And I canceled patients the next day, and I'm slamming my antiviral herbs because this must be the flu or a virus of some sort. Ended up having to take like Dayquil or NyQuil just to function. I didn't seem to have a fever. So I wasn't contagious, but I was limping along. I only saw like critical people I had to see. 3 weeks went by and I don't have health insurance. So I was like, screw that, I ain't going to a doctor. I got antiviral herbs and vitamin C. Sicker and just fatigued and felt like crap. My belly's killing me from all these ice cold energetic herbs. And I finally was like, I obviously have an issue. So there's Chris in Iran. So Chris is an herbalist who I had a lot of respect for. She reads and writes Chinese, studied in China for many years. She's over there now. She lives there now. And so I was like, I call her. I was like, Chris, you got to help me out. I'm dying here. And so She's like, come on. And I told her what happened and she laughed at me. She's like, dumbass. Like, why did you do that? You have chi deficiency and you took all these cold herbs. And so I was cold and deficient in my nature. And I still am, even though I use coffee to pretend I'm not. And so I took herbs that were cold when I was being attacked. And so I was using Chinese herbs like they were medicine from an MD. Like, here's a symptom. And she laughed at me. She did a little moxa and gave me a proper formula. Mine are blue green dragon for anybody who's listening who knows this. And I was better the next day. So literally with 24 hours with again, trying to treat ourselves is a challenge as much as it is to like try to take a relationship with a loved one or a family member and try to pretend you're not a family member. So in this case, since that day, I have never treated based on here's an antiviral.
Well, not only that, it's the adage of echinacea is for colds. No, it's not. Like, that's not how that works.
Yeah.
That's not, none of us ever in a family household catching the same exact germ. Nobody reacts the same way. So being very mindful of owning the experience of that person at that time and place, like, tell me what you see. Don't ever go on assumptions. Tell me what you see and try to course correct those imbalances.
And it's funny, dozens of times I was successful doing what I did. This one time when I really ignored energetics, I didn't tune into my body and notice that I was chilled even though it wasn't cold out. And so nope, you'll get away with it 9 out of 10 times. Every one of us has probably been sick at some point, took some herbs and got better and didn't think about energetics or hot or cold, wind, evil, blah, blah, blah. But boy, sometimes it matters. And so we will always be more effective. We'll have less side effects if we take the time to figure out the constitution of the individual, the constitution of the illness that we're seeing, and match those herbs up appropriately. Western or Chinese, it doesn't matter.
Any questions about that or anything else we're saying? Because you guys are awful quiet tonight online. It's okay if not.
We got a couple of these, so let's do those. It's very plant focused. So we were, what is it, Body, Mind, Soul, or maybe it was Orange Blossom Jamboree. I don't know, one of those.
It was Orange Blossom.
Was it Orange Blossom? Yeah. Yay, we're going to do that one again this year. So we periodically, whenever time and people ask us, we go to some of these music festivals, and we'll work first aid and do an herb walk or a lecture or two and things like that. And we went to this one, and really we did an herb walk, and this one young guy, Native American guy, came along and was super smart and was chiming in what he knew about it.
His wife was a midwife, and he was a tracker.
Yeah.
And he was really young, but he was
super smart,
tribal and very smart.
Yeah.
And he was legally blind, actually.
I'd forgotten that.
Yeah.
Maybe that explained really part of it.
Yeah, exactly. That gives you an idea. But he was spot on. He was on it. Like, for a young person.
And he ended up doing mushroom foraging, and we don't know a lot about mushrooms, so we followed him, and it was like, oh, this guy's sharp.
He was really sharp. Yeah.
And so we're all sitting around. I think you'd made some Wayusa or some cacao or something, because you did a class in cacao ceremony, I think, earlier. And so we were sitting around doing that. And he comes over and he's like super high energy. And he kind of plops down on the bench at the picnic table. A couple of us were sitting around. It's like, I found this great new herb. It's like, it's really spicy. You got to try it. And normally I will never take anything from anybody. But I like this kid. He seems super smart. Like, who am I? He was Seminole. Really cool. I was like, I'm not going to question a Seminole guy. And so I take this little red seed and I pop it into my mouth and I bite down on the pulp, and I kind of, what you should always do. I
have so much to say about this.
Put it like right in between my lip and my gum, and I'm kind of like sticking my tongue on it and like, oh yeah, that is spicy. Huh? What is this again? And he goes, oh, I don't know.
Oh, no.
And I'm like, no, this is kind of hot. I think I took it out about then. And it was about then I remembered a particular flavor. And it is the calcium oxalates, which are in a number of poisonous plants. And there's one Chinese herb, ban sha, for you Chinese folks, that is the pain of 1,000 needles piercing your stomach. Luckily, I only had this in my face. It wasn't ban sha, but it had the same chemical that's in ban sha. And so I was like, oh my God, in my head, I'm going, I've been poisoned. And so I did an equally dumb thing as taking a plant, not knowing what
I
it
love
was.
this because it's literally everything word for word verbatim that we tell you not to do. he
Right.
did.
And,
Like
and I wish I
everything
could
we've
say
ever
this.
said. And his nickname is Safety Bob. Like,
Yeah.
no joke. Like, out at places in different countries, people get Bob to help with something. It's like,
So,
dude, you did everything you're not supposed to do.
so I was like, this is hot and burning.
I'm gonna
I'll
die.
use energetics. And so I went to go, and I don't remember what I was looking for. It was like Biden's or something. I was like, I'll go get some medicine to try to fix this. And so I run literally away from the group.
Never run away.
And so nobody knew where I was going, what my problem was. I ran and didn't find it. So then I ran into the woods where nobody is,
Oh my God.
looking for some plant. I don't know what it is now. And there is the pain of 1,000 needles piercing my face. And I'm sitting there kind of running through my head, calcium oxalate, am I going to die from this? And so I came across Greenbrier Smilax, Tu Fuling in Chinese. And I was like, hey, this is steroidal-like in its action. I could probably use some steroidal-like action in my face right now. And it's energetically kind of cool and draining. So, of course, the part that we use for herbal medicine is the root. And the root that I found was too big. I couldn't dig it up. I needed literally a pickaxe. And so usually we can break off the tender tips and we say we steam them. They taste like asparagus. Yay. There weren't any, wrong season. So I literally grabbed these hard leathery leaves and by the handful and start stuffing them into my face. Remember, nobody around, dying, poisoning from calcium oxalates. And I'm stuffing this all in my face and I'm like chewing it up and it's like, and it's disgusting tasting. And I start moving the now green spit and it's like drooling down my face. And I'm moving it around in my lip and washing that lip out and the pain backs down. And so I grabbed a couple more handfuls and stuck them in my pocket. And now I'm used to it and I don't mind the bitter taste. And I walked back and I was like, you might not want to eat that. So some of us, somebody's writing. Oh,
I got it.
Okay.
I'll handle it.
So don't eat anything you don't know what it is. To include from somebody, even if you think they know stuff.
So I do want to say something about this because everybody has been out with us and Bob's like a firecracker and he's excited and encouraging and everything that he needs to be for us to go on plant walks. And I always stop him and do the like general introduction of, hey y'all, if I pass it to you and it went in my mouth, you can eat it. If I tell you not to eat it, don't. Like, that's the reason why I do that. Even when we're harvesting in safe places, I always put it in my mouth first, looking for a certain thing. Like, we're being very direct. If that young kid would have come to us and been eating it, it wouldn't have mattered. We would have watched him get sick in front of us way before we would have done it, but he didn't. He probably just tasted it or put it on, did exactly what Bob said, not quite realizing what was going on.
And we didn't say what it was. It's Jack in the Pulpit.
Which is
Tian Nanjing for the Chinese folks.
literally to kill you. Like,
Yeah.
that's what
It's considered a
Jack
poison.
in the pulpit. Like, Jack in the,
It's
he's
pretty
up,
plant, and
that-
I've never seen the fruit of it before. It's beautiful.
when your casket's up on stage, when you're dying, it's in the pulpit. They put the casket in the pulpit. That's what it's named for. Its name is for death. Like, solid. Yeah.
So, and frightening. We've had a couple of self-poisoning stories. Renee has one.
Oh, I'm solid with this. This is good. This is
So,
definitely.
I don't remember what we were doing, but,
Oh, I remember it. It was so.
but Renee is enthusiastic sometimes.
Exactly.
And the same
Just
way I am invincible, or at
Right.
least I believe as much. She's even more so. I just don't suffer the same consequences as she
It
does.
was just such a minor amount.
And so there's this little weed in a pot, and she goes, "What is this?" and stuffs it in her face. I knew what it was.
You were
She-
inside though.
She didn't take the moment to
No,
ask me.
I was putting it in my mouth as I was walking in to ask him.
Yeah, and it's a euphorbia, And
which is poison.
most of the euphorbia, there's a few exceptions, but I'm going to say 95% of all the euphorbias are very poisonous. This particular one was used for cancer.
This is 2 lessons, maybe 3.
And so the problem is it's not used for cancer by eating or drinking
No,
it.
it's for burning.
There's a little white sap that comes out and you put that on a tumor and it burns it out of your skin.
like a
It's
black rotten.
caustic.
It can eat your nose off. So I
And,
put that in my mouth, swallowed it.
and
Mhm.
I have my own share of sensitivities and
Mhm.
allergies and so forth. She has more.
I'm super sensitive. So I want to say this because you don't know what was going on before I walked into you. So this is 3 lessons. This is the mom in me. So this is 3 lessons. The first thing is always know what you're putting in your mouth. And I made the mistake of trusting someone because it was in one of our pots on the back shelf, like to be sold. And so we wouldn't sell you guys something that you could mistake and have and eat and make it in danger. It had self-seeded and I didn't know that. Well, I was dumb enough to trust that if it was in the pot on our back shelf in the clinic, that it was something that was something. Like I would like, so that's my first mistake because I trusted, I just was naive to it. The second thing was, if we give this to our other clients and our other students that are not new to anything. If you think in your head, if there's any time during something you're doing and you think in your head any of these 3 statements, should I call 911? Should I call Bob or should I call Renee? That means you should.
You should call 911.
If you think that, that means you should call 911. So that's a second lesson, like a mom lesson. They're happy to assist you when you're not sick because that means they don't have to deal with someone who's dying. They're happy to come out for no reason. If you think the word, should I go to the hospital? You should already be on the way to the hospital. So as I put it in my mouth and it started burning, I could feel my throat starting to close. So I walk immediately, like it was a 30-second transaction. I walk in and be like, what is this? I'm standing there. I'm like, I'm going to the hospital. My throat is closing. Text me because I need to be able to tell them. I timed it. We were around the corner from hospital. It took me 7 minutes to get to the hospital. I didn't park the car. I pulled into the driveway. Couldn't see. My vision started closing. And as I'm walking in, my phone goes zzz, him texting me. And I threw the phone up and said, I just poisoned myself. That's what it is. I can't see. And the guy like grabbed my phone and ushered me to a room. And within 15 minutes, sight's coming back. I can breathe. Everything's fine. And so it was that fast. So in a 20-minute period,
Very similar to what happened to Patricia that we started.
I
This all with,
poisoned
just
myself,
different plant.
decided I was going to die, got to the hospital and was okay in a 20-minute period where I was like, oh my gosh, this is crazy. I need to go to the hospital, figure it out. No. And
So
yeah.
not only should we never eat a plant where you're not
Nope.
100%
Don't
sure what it
assume
is,
anything.
but in the case of the euphorbias, they all have a white latex.
Yep.
And so as a general rule, unless you know exactly what that plant is, if you break the leaf or the stem and you see white stuff coming out, don't eat it. And lettuce has it, dandelion has it, papaya does, but it's 90% of the time it will burn a hole in you. Yep.
Oh, that's what I was gonna
Yeah.
ask you, dandelion has it,
Yeah.
milkweed has
Mhm.
it.
Yeah.
Yeah, but those will do it too. Mhm.
Okay.
So it's just about
Well, we use
exposure.
dandelion in Germany.
Yeah, those
Yeah.
are those
So
are
does
the
romaine.
those are the exceptions.
So does
Oh, okay.
romaine
Yeah.
lettuce, but they're not exceptions in the aspect of it causes great toxicity. So that if you a good example, because you guys are most of you are in class with me. So I've told you a story, and if you haven't been in that class yet, I will tell this story of if you eat too much dandelion and you're not pooping right, you'll get vilely ill and start
Yeah,
vomiting.
But the plant itself isn't poisonous. The plant itself
Right,
is
but
fine.
it can cause a toxicity. It can cause you to leach these things from your body, and if you can't remove these poisons from your body, they'll be
But if
removed
you-
whether you like it or not.
If you know the plant, like this is lettuce, like all lettuce has white.
Yeah.
I planted lettuce seeds here. That looks like lettuce, tastes like lettuce. It is lettuce. You're good. But if you're like, what is this? Let's break it off and see if it has a smell. What's that white crap? Don't be eating that crap. You end up next to her in the hospital.
If you don't know. Yeah, but there was no hesitation. Like there were so many times in my life I should have called 911 and I didn't. So many times I needed stitches that I just taped that thing together with some duct tape. Like there's so many things that I didn't call 911 for. I knew immediately this was not good. And I did exactly what I told you guys. If you think in your head, I might need to go to the hospital, you should already be driving in that direction, like for sure, or be calling 911.
So, and I have more poisoning stories coming up, but I'll save that towards the end because I thought that last one or my last one is great. There's a couple here. I had a client, he came in and probably the worst edema, and I've seen some really bad
This is very
edema,
interesting.
had the worst edema ever. Like he's a short, stocky little guy, photographer, and his legs looked like he was wearing watermelons. He had to wear flip-flops because he could no longer put his shoes on. And he'd been to the hospital and they'd given him Lasix, drained all the water out, but he refused care. He threw their drugs in the trash. And he came to see me, and my first time seeing him. He drank about a fifth of whiskey every night and was smoking probably 2 packs of cigarettes and wouldn't know a vegetable if it bit him in the ass. And I insisted on raw herbs, which yay, and he was down for it, didn't care what it tasted like. And he was pretty compliant for a bit. And I actually was able to get the swelling back down and was good for a couple of months. And he comes back in, he's like, it's back, you got it. And it was worse than it ever was. So I made the herbs for him again. I made an assumption he knew how to make it still. I didn't reiterate the exact directions. Hadn't been that long. He did it for a month. So it was like, here's your bags of herbs. I gave him like 10 days worth of herbs. So I think it was, he reordered the herbs and he got them again. And I was doing a follow-up. He goes, yeah, this batch is way worse than the other batch. I was like, I did change it a little bit, but who knows? And I don't remember whether it was him or his wife. He goes, it's really fascinating what these herbs can do. And I don't understand. There's like a flower on the inside. And I had thrown some flowers. There was like Chuhua, some chrysanthemum flower or something in there. It didn't really register what he was saying. And I think it took me another appointment before I figured it out, that his herbs were lasting too long. And so what I finally figured out was he was leaving it on the counter, because I had said that, like, you're consuming a bag in 2 days, it's not going to get furry, you just boiled the crap out of it. He was leaving it on the counter for a week or two, and I don't know, I guess we could call it a SCOBY was forming, a flower. There is literally this fungal weird growth.
Gross.
Because he didn't follow the directions that I'd given him now months ago. Common sense would go, if you leave it on the counter, it's gonna get furry. And he was drinking it like a champ.
Oh.
A couple times a day.
Wait,
he was
my
scooping
question,
it out.
I have a question for you, Dr. Bob. As Dr. Bob and Safety Bob,
He had
and
phlegm.
I'm the king of Herbal Mistake Bob. Did you tell him that, or did you say, oh, that's okay, and give him other directions?
I gave him new directions.
But did you say? You didn't, did you? I told you. See, the doctors don't. They say, oh, okay, that was okay, then let's try this one. Da da da. And they don't say.
Let's change the cooking instructions. I got some different herbs for you.
Yeah.
No flour in this one.
Oh my god. That is disgusting.
It was blossoming.
Yeah. But we talk about that in 101 when we talk about the tinctures, where I say, yeah, you and I might scrape it off the top, smell it, decides it's not rotten, but we can't be sending people home with
Not
that.
so much.
Yeah, we have to be very, very careful about the
But speaking of
labeling.
how we might do that,
Yeah.
I can't even think of a particular case, because I won't say it's common, but it's not rare.
What is it? What is it?
That we give, we think, we did a good intake, we put together a formula of herbs, Western or Chinese, doesn't matter. And they actually will say, wow, like I'll get an email that says, those are some really strong herbs. I can really feel it. And when I do a follow-up a few weeks later, I find out they've been peeing out their butt for 3 or 4 weeks.
And they're not
they were
articulating that?
thanking me for the cleanse.
Oh.
And so I'm sorry that, and there's what's called a Herx response, usually a Herxheimer response, which is flu-like symptoms, nausea, vomiting,
It's
diarrhea.
similar to the thing I was talking about with the dandelion.
Well,
It's not
yes.
wrong what's going on. You
Herx,
just feel sick
Herx,
when you have
Herx response does exist. Usually that means I just did a bad job. And on more than one occasion, I didn't get my diagnosis right. I gave them 2 cold of herbs and they literally purged their butt. Um, so there's weird ideas in Western medicine or Western herbalism sometimes. Excuse me, not I won't say Western herbal medicine. In alternative thought, when we're using Google and Facebook as our primary means of learning medicine, where we do colon cleanses and purges, and people intentionally are making themselves pee out their butt. And that is not the way I practice. And so it's
yeah, but
super,
that's very normal for like the Ayurvedic practitioners and the Chinese
yeah,
practitioners.
but then it's intentional. So it's important
but they
that
don't care.
it's important when we have a conversation with our clients, when we're giving them herbs, the reactions that we expect to have. You should sleep better. You should feel
so
better.
this falls under the heading of client
and,
expectation.
and also in the same way, if you go and get a prescription medication, there are cautions. So we should say, if you get loose stools, if you get bloating, if you get insomnia, discontinue and contact me. I'm usually pretty good about that now. I will say, and sorry, I'm cheating, doing more Chinese than Western. Anything that's got Romania in it, Shudi or Shengdi, and actually Hisho Wu, Polygonum multiflora, the potential is there for that to cause a lot of bloating and loose stools and gas.
Can I speak on this a little bit
Yeah.
more? We kind of have the time to do it. So it's important for us to be thinking about the term like Herx response, because this happens in everyday, very normal things like supplementation, where we will have somebody take too much of something because that's what they Googled, and they'll have this really excruciating stomach ache, or they will be on the toilet all day long, or they think that everybody should be doing cleanses, and we'll have this like overreaction or excessive versus deficient, an excessive reaction to something, and everything that they read that, oh yeah, detox and cleansing, this would be good for you. And so it's important to understand that we have a roadway, a map to health that doesn't include further damage. It's possible to not be in pain to get well. It's possible
You don't have to suffer to do well.
to be able, and that is just bad formulation, and that is just bad advice. If it's damaging your other energetics.
And I will give a caveat to that story as well. I have had a client who I gave a very, I know was a correct formula. I felt very secure in my formula. And they called me up 3 days later and said, "You're trying to kill me. I have horrible cramping, diarrhea." And I'm like, I pull up I'm like, what the hell? There's no way. They must have and I'm like, is there anything? Do you have any allergies? Are you sensitive to this? And I was like, well, just stop taking it, and
We'll figure it out.
and so they do a follow-up, and I'm like, I don't understand why this caused that, and it's important we figure it out so I don't repeat this. And I got smart, and I was like, so what were you eating before that? And they got sushi the same day that they started taking that. And I won't say it was like street sushi, but it might as well have been. It was from a really crappy sushi joint. And that was food poisoning, not our herb. So sometimes the adverse reaction, the Herx response, has nothing to do that it just happened to coincide with them eating really bad food. So not to say, I mean, no, we do have adverse reactions.
So
with
let's
herbs
say something about this too. That so 100%, we do it, everybody does it 100%. It doesn't matter what they were doing, they always blame the herb.
Yeah.
So they do, for real. Like we'll have people who come back and say, I had a stomach ache, I had this, I had that, I did I don't want this formula anymore. And then we find out that you had a bunch of raw food before that, and don't even want to take into account the fact that it's it's a raw sushi. So we do this constantly. Like we don't think it's the side effect from the medicine. It's got to be those crazy alternative doctors with the herbs. And so it's something that's very common for us to blame for sure. If we are, I'm talking to several of the people online are advanced practitioners. You guys, we have this happen all the time. People will stop taking their herbs because they have this reaction. They think that something's wrong and they don't take into account the weirdness that they're doing themselves or what they've exposed themselves to.
So the next one is very Chinese, but I'm going to argue that it's just as Western. Languaging is always a challenge. Obviously, if we're in Chinese and we're literally talking Chinese, and none of us actually speak Chinese, it's easy to make mistakes from some subtleties. But we yell at folks about common names. So if we use the common name, that
I have a question whenever you're ready, but keep going. Finish this one and then we'll go to
we can make some
drastic mistakes.
Yeah, and I was trying to think of a good Western example, and even with Latin, yeah, there you go. At least nobody dies from that one. But also, even with Latin names, because I don't speak Latin either. And so I'm like, it kind of sounds like it or looks like it, but I don't actually confirm the spelling. I've made that mistake. We just went out to Sweet Bay Plant Nursery in Bradenton, and we go through and we look at the Latin names, and I was like, that sounds familiar. And sometimes I'm right, sometimes I'm wrong. That's medicinal herb that I think it is. And so common names, it's really easy. You can have 10 cudweed is our favorite example. Depending on who you ask, there's a half a dozen just in Florida different cudweeds, completely different genus and species, and potentially function. So in this case, these are two Chinese formulas, Ba Zeng Tong and Ba Zen Wan. So,
and we all don't know Chinese.
And so, sorry, this is my other ex-wife. And she tended towards blood deficiency. I was a very new practitioner. And she was like, hey, can you bring some of the Bazenwan home? I was like, sure. And so she asked for the bottom one here, Bazen. This is the 8 substances formula, or women's precious, it's sometimes called. It nourishes the chi in blood, and she was a little deficient. Very correct formula for her. I, in a hurry and not paying attention, grabbed the top formula, and I don't know whether I heard her wrong, but the top formula, Ba Zeng one, is called 8 righteous and is used for urinary tract infection. It's very cold in its nature, damages the chi if you take it long time, and can increase urination and make you pee out your butt. And so she didn't really look at them. She's not really good at the Chinese. And so started taking those 3 times a day, way bottle said, and she started getting really tired. And then she started to get diarrhea. She's like, I think I'm coming down with something. And I was like, these herbs aren't working for me. And I was like, oh, that might have been my fault. And so anytime we're either grabbing an herb for somebody or working a formula with somebody, and I don't want to say how many times my students have written down, there's another good example, sorry, it's going to be in Chinese as well.
Yeah.
I can think of a bunch, Bob.
Dangshen.
Gynostema and gynostema. I mean,
Oh, yeah. So Dangshen is Cotinopsis. Danshen is Salvia. This one nourishes. This one sends the blood, calms the shin. So totally different animals, one letter different. And from a Westerner talking to another Westerner, sound exactly the same. And so I'll see the students writing out the formulas. It's why we tell our students to make sure we look at it and check it. And they're about to pull the wrong herb and put an invigorating, I won't say dangerous, powerful herb to somebody who needs to be nourished. And, luckily I think I've caught that every time.
So I have some, this is a great, I'm going to read it to you. This is a great thing. And I have a lot to say about this. So if you don't, I'm happy to speak on this for sure. It says, do we have some rules of thumb or a key consideration that would drastically lower our chance of a Herx fiber response? Off the top of my head, I'm thinking making sure there's no constipation, liver, kidney are working well, and they're able to sweat. And if MTFR, for example, they're responding, they're supporting their liver before beginning a heavy duty formula. And there's so much to say about this because we, from a clinical standpoint, ask for so little from the students, and we don't get that delivery back. We get this excessive amount of information delivered back. And if we only stuck with tongue pulse poop, are you peeing and pooping? Like, what is your water? Are you peeing and pooping? And what are your energetics? We could go a long way to stopping a lot of these Herx responses, but slow and low is
I was going to say,
gentle. Yeah.
Obviously diagnostics, getting a proper intake with all the information, and you'll never get all of it, but the best you can. And
Water and poop are so important.
Is this person excessive? Is this person deficient? And then formulating correctly around that. But the single most important thing you can remember is low and slow.
Yeah.
So start with a low dose, maybe even subclinical, and increase it slowly. So it's funny, and I know I've got a couple of Chinese students on here. I know in acupuncture school, they'll say on the pre-made formulas, right? They'll say, oh, you've got to double the dosage at least. So let's say on the golden flower formulas, it's 2 pills 3 times a day is the bottle dosage. And so they would expect that no matter what, you have to give 4 or more pills 3 times a day.
But that's the same conversation I have about traditional medicinals.
But what I do is, and my students will actually see in class that we go lower. We do 1 or 2 pills twice a day, and we still get results because we emphasize the good diagnostics to find out what the imbalance is. If we choose the right formula and even go on this subclinical dosing, you will see benefit, and you're less likely to have an adverse or a Herx response.
This is also where, if you're coming from all raws, good formulation comes into standpoint in the supplementation. Like for this person in particular, I'll walk people up to our supplement area and I'll go back and forth between just something as simple as the probiotics because of that, because we know the ones that are going to cause that really nice effect of fixing your flora and fauna, which means it's killing off all the overgrowth. Well, we can't do that with somebody who's in critical care. We can't do that with our cancer clients because it's just one more stressor on their body when they're in cachexia or they're not nourished well, or with an animal. So we'll have to do exactly what Bob said. Understand that if you've been in this problem for 20 years, 15 years, 10 years, it might take 10 weeks or 10 months, like exactly the weeks or the months to reverse you out of it. So it's very important to know that as well. So pooping and peeing is the most important thing, because you have to be able to move that toxicity load out and not disperse it somewhere else into your body. If somebody's going to the bathroom regularly, you're less likely to get a rash, the sweats, vomiting, any kind of stressors in the gut. And the other thing is good, guided, clear communication, so that you say to them immediately, like, don't distress, like the woman that called Bob that said, oh, you've really been putting me through a detox. Like, immediately call me if there's some kind of thing that's not exactly normal. You should be able to go on about your normal day of life. So Bob is right that you don't have to hit it with a baseball bat if you have good formulation.
And it's easier to increase a formula than go, oh, sorry about that. Maybe you should dose that down a little bit. So I always start with a low dose
You don't want to
and
scare
see
them
how
off.
people do. Yeah.
I always say, like a joke, you're trying to get a squirrel to come over to you. You don't make big movements. You lay out little nuts one by one and like get them over to the plate. Yeah.
I have a question. When you say it hurts yourself, like how do you like?
HERX is in the response. It's very, yeah, and it's very specific.
We say Herx because it's too hard to say Herxheimer.
Herxheimer. So the response refers specifically to candida infections, but we see it in many other things. And it's an overreaction. It's not an incorrect response. It just is going to make you sick. When you have a die-off of anything, when you have an overreaction of anything, you have an excessive state. So that could be a rash, venting heat to the outside. That could be uncontrollable crying. That could be uncontrollable sweating. It could be vomiting. It could be diarrhea. None of that is wrong. Like many times we have purging protocols. We just choose not to use them because nobody, I always make the joke of nobody, this is the book I wanted you to use. I don't give it to you anymore because nobody in America is going to do these things. It's an old timey herb book that I love. And so the Herx response is when you have an overreaction that is the correct reaction, but it doesn't make it, like in Bob's case or my case, if we properly supplemented to get a response of a die-off, we would need to stop work for 2 weeks. Like literally, we will tell you, we will give this to you and it will fix your gut and it will do it fast. You need to stay home from life for 2 weeks. That's how bad it is on your belly, but it will fix you quick. So we'd rather do it over a large amount of time, like 6 weeks or 3 months, and not have that horrible effect. So the rule of thumb is that you're drinking enough water, your gut is working properly, and what you're taking in is what you're taking out. So as you pull in, you're pulling out. And so good pooping is a huge thing, which nobody ever wants to talk about that. What you got?
So there's a couple stories that relate to this. I had a client, this was a million years ago. She was a fascinating case. She was a volunteer first responder at 9/11 and was, after the building had come down and they were just cleaning up debris and doing PTSD treatments. And she was doing, I think she was like 6 weeks at ground zero there. And ended up getting really sick. And her primary way that it was manifesting was these horrific sinus infections. And she was treated for about 3 years, I think. I don't know. I'm probably off on that, where they were doing, I think they did 2 surgeries. They're doing all these serious, like, this antibiotic may kill you or it may save you. And she had exhausted all of those. And she started to get the sinus infections back again. And it basically said, it's going to eat through your the sinus cavity into your brain and you'll be dead in 6 months. Bye-bye. She had been unable to work, had PTSD, had weird rashes. She had a really, I'm going to say fairly rare autoimmune disorder called dyshydrotic eczema. And a few other random, actually, and herpes.
Mhm.
And so there was a lot going on, and so used Chinese diagnostics to try to understand this mess of stuff. By the way, she's still alive. So she did not die. We did this poor woman. I have a lot of stories associated with her because I tortured this poor lady. She was a trooper, but her formulas were large and far exceeded what would be considered normal and average. They were usually like 3 formulas matched together. And we were oftentimes chasing whatever symptom was popping up at a particular time. And I had just altered her formula a little bit, and she had started taking it, and at this point, like, it was well past the 6-month mark. She was doing much better, but still had issues. And I get a phone call in a panic. She's like crying hysterically, can barely understand her. She's talking so fast. And she's like, it's finally happened. It's eaten through the into my brain. Do I go to the hospital? What do I do? I'm gonna die. Like, and I had a moment of panic as well. Not my normal phone call. And I was like, take a deep breath. Give me a minute. Let me go look at the formula I gave you. Maybe there was something I did. And
Why did she think that? Could you remember the symptoms?
she was having horrible heart palpitations, like racing brain, anxiety.
I think that's important to say.
Yeah. And literally was like shallow, rapid breathing, like not good signs for anybody. And I looked at her formula. It was like, it was hardly any different from the other formulas. I changed a few numbers, added an herb, taken an herb away. And it came down to these 2 herbs, jujube date seed and polygonum called Seneca. And these are one's nourishing, the jujube dates are nourish the blood. We say calms the mind. And we were kind of working on the PTSD. And the yuanzhi is an herb that also calms the mind, but gets rid of phlegm. And she had lots and lots and lots of phlegm. So I decided I needed to clear the phlegm, and I did a little bit more yuanzhi to get rid of the phlegm than the swan cell run. And I was like, I wonder if I made it too dry. Literally the only thing I could think of. And so, poker face, I played it cool. I think I know what's wrong. And I said, and she had a lot of just pre-made formulas. So I asked if she had swan cell wren formula there in a bottle, and which is a couple of herbs, but primarily the jujube dates. And I was like, if you got some of those, I need you to go and chew up 4 of those and then call me back in 15 minutes. And she did. And all of a sudden she could breathe. Everything settled down just from chewing up tablets. And I was like, I'm going to put some herbs out here on the counter. Just spin by at your leisure to pick them up. Don't take that formula until you mix it in. So literally it was diagnostics, what I decided to do with the formula, but those 2 herbs are what we call a duo, a pairing, and they're there for a reason. And I broke a rule. I gave a little too much of the Seneca root, the yuanzhi, and not enough of the other. My diagnosis wasn't tight. I just lost sight of
Are
it.
they supposed to be in balance?
And I would say I usually encourage, except in extreme cases, more of the jujube date. So both of those herbs are super safe.
It's super nourishing.
But what it came down to, and it will make sense in the next, my next screw up. If we're going to put an herb into a formula, we should 100% understand its action and purpose in a formula. There's times when
Or don't use it. Just
right. And so we go, oh, I Googled it. I don't know what
we were just talking
our
about
students
this.
are so guilty of this.
Yes, we were
and we
just
yell at them.
talking about this.
And I don't remember, it was actually last week. I don't even know that you were there. Somebody started to put an herb in there. And I was like, did
What's
Renee
that?
teach you that herb?
Yep.
They go, no, but
Exactly.
I saw it in the book.
Nope. I
I
didn't
was
teach
like,
it for a reason.
Have you ever used that herb? They were like, no.
Then you don't
Like,
do it.
let's take that out.
Nope.
What do you say? I'm not going to say it wasn't wrong,
But you don't know it.
but
so
it
you
wasn't
can't do that.
right.
Right.
And it didn't make sense. In this case, I was very early in my career. I passed my test. I hadn't really worked with this herb, and I lost sight of what its role was in the formula. And luckily, it gave the feeling of dying rather than dying. and too often, people are making formulas based on Google. They're taking supplements based on Google. They don't understand what it's doing. And whether that's from a physiological standpoint or an energetic standpoint, it doesn't really matter as long as you understand it and its interaction with the other herbs in a formula. So there's a whole slew of common pairings in Western and Chinese. It's not unique to the Chinese.
We definitely do the herbs are popular, herbalists are not.
Right.
And please don't mistake my 40 years of experience for your 5-minute Google search. Not like if we could go to an orthopede, if we could just Google what we needed to do, why are we going to all these specialists? Why do you think you can do that?
Oh, I didn't tell you this one. So these 2 women, and they were super nice. They came in and they were like, ooh, herbs. And they were like, almost the first words out of their mouth were, so where do you buy your herbs from? I want to buy some. It's like, we sell them. They're like, well, no, I'm going to make some products and sell them. It's my new business. And like, I'm like, well, we have a number of suppliers, and she was like, well, I need cacao and I need mushrooms, not a particular mushroom, just mushrooms. And it was obviously had no idea what they were talking about, had no idea. And I was like, well, if you're looking at, 100 pounds at a time, we can give you some sources if you, and they were clues. But then I heard them talking. She goes, I think it was pawpaw. She saw pawpaw, the pawpaw fruit. She's like, our waiter was telling us about pawpaw, that it was good for cancer. Is this good for cancer? Yeah. that's where I look for a valid source of information on my healthcare for serious disease like cancer is my waiter.
And what
And-
kind of
And
cancer?
these two
And
women
who
were
are they?
about
And-
to make a product line that they were going to tout it as raising the dead and curing everything. It was horrifying. Uh, I wanted to say rude things, and I was polite, and Christina actually laughed at me because she was like, "Oh my God, you totally just said the rudest things to them, and they didn't know it."
Okay, you are 5 after 8.
Okay, I got a few more
And
here.
so what do you
We're
want to
getting
do?
there.
Pick one that's a
Um,
good one. And
So,
a factor you want to drive home.
and
an
oh, there it
idea.
is. So I want to talk about knowing your formula and knowing the herbs in there. I had really sharp student, or she's a graduate, that really knows her stuff. She was creating a formula for herself. And I try really hard to not like tell people the answer. Our students are there to learn. So part of that
What do
process
you think?
is finding the right formula. The Chinese books are really, like, hey, if I've got a diagnosis, I can go through and find the formula that's right. And one of the things I tell all my students is, don't be given an herb where you don't understand a formula unless you understand what it's doing, and what each one of those herbs does in the formula. And it's nice. It's in the textbook. It's really cool explanations of all those things. So I kind of pointed at her as like, well, she wanted to get rid of some phlegm. She'd been eating poorly and she was feeling a little bloated, a little edema. And so I was like, well, look in the drain dampness phlegm section in the book and tell me, find a formula that you think is appropriate. And she's flipping through there and she's looking at like the names of the formulas and maybe the first indication. And she took a half an hour. She did a good job, but she didn't look at the herbs in the formula. And Chinese do some freaky stuff. We use some toxic things, like we use Jack in the pulpit. That's an herb that we use, and sometimes safely, sometimes not. We also we have classical formulas that use things that are unethical or illegal, or science has told us was maybe a poor choice in the past. So she finds this formula she thinks is perfect, and it talks about phlegm and kind of blocking the orifices. But she didn't read all the way down, that it was really for like seizure disorders, not for I'm a little bloated from too much pizza and beer. And she didn't read the herbs in it. And so there was some herbs in there that I asked her if she knew what it was. I think it had, am I spelling it right?
It's on the very bottom.
Zusha. This was one of the herbs. I was like, do you know what Zusha is? I know I taught it to you. Do you remember? She goes, no, I didn't get that far yet. I was going to read them later. It's mercury. So we use things like mercury in its raw form.
Not anymore.
Or yes, we used to. We don't do it anymore. That's illegal. We use things like rhino horn. That's unethical and illegal. And so it's important that before, whether Chinese or Western, that we understand that herb so completely. And when I was like, do you see that? It's like, I don't think you have seizures. I think you have pizza and beer. And I'm pretty sure you don't need mercury. Especially in the Chinese Medica, there are so many formulas that are classical, but we remove those toxic elements and replace it with something that's safe. And too often people copy it. I've had practitioners ask, like, we supply herbs for a lot of the local acupuncturists around, and they've literally said, I want 10 grams of Zusha. I was like, you're an idiot. Because they Googled it, and so hopefully they got their diagnosis right, but they're literally just grabbing stuff out of the book and throwing it at people with no comprehension, no adjustments or anything else. And so Western or Chinese, we need to understand the herbs. This is, we call it a pharmacy, with a PH, not an F. Those herbs, we use them like drugs. They have drug-like actions. They have chemicals, and we put a bunch of these chemicals, these herbs together to create a physiological response in the body. You damn sure better know what it's going to do. and it's scary when we don't. All right, I got Oh, I'll do the last one. Maybe I'll have time for one of the others because this is one of my favorites. I like plants, in case y'all didn't know that. I think we both have an addiction. Um, if you've seen out back here, it is quite the jungle. It's growing nicely. It's starting. We were joking about it. If half of the trees grow that we planted, we're going to have like a triple canopy jungle out there in 5 years. So I think it was last weekend, or maybe it was 2 weeks ago. I had a day off, and so I was like, I'm going to plant shopping. I don't need any more plants. I went and bought $200 worth of plants. We had half a day off. Obviously, we came to do this. We were like, you don't have anything to do? I don't have anything to do this morning. Let's go buy plants. And we just bought a bunch more plants that we really don't need. We want them. And so I really enjoy growing plants. And I literally, if you see me standing outside next to a tree or a plant or a bush or something, I'm going to start petting it. It's like my dog that doesn't move around much and doesn't need to be walked. And so I was growing aconite. Aconite is a deadly poison. Futsa is the processed one for the Chinese folks. Sao Wu is the unprocessed, toxic, deadly poison that there are of the deaths around the world, in China in particular, from herbs is very few. Something like 2/3 of them are aconite poisoning, because it's not processed properly or something like that. So if you've ever seen a picture, you can Google it. Monk's hood is the other name for it. It's this very but the flower is this dark, rich, royal purple blue color, and it kind of comes up and it has a little cow. It's a stunning plant. And I was doing a free herb drug interaction class, and they had emailed, a bunch of people had emailed, they were new graduates from the pharmacy school in Bradenton, right? It's a PhD, it's like going to med school. And these new graduates were so excited, and they were coming to my class. And I was like, oh shit. I was like, I am not a pharmacist. I'm like, oh great, these guys are going to start asking me about the CYP 450 enzyme pathways, blah, blah, blah. I was like, oh, I'm freaking out. And I'm like, you know what? Let me talk about what I know and not what they know. And so I thought I would talk about aconite because my flower had just bloomed. It was the first time I'd ever seen it in bloom. So I went out and I was like, well, screw it. I'm not going to make medicine out of this. I'm not educated enough to process it. So I just clipped it and I put it in some water. And I'm just like, whoa. And I'm coming up with this great idea. Is like, I was going to take some processed futsa and I was going to put that in water, and I was going to eat that and then talk about how this would kill me if it wasn't done right. That's the magic and excitement of Chinese medicine. And I'm literally petting this plant, this flower, and the whole time, and I'm just like, I can't keep my hands off of it. And I was also nervous, so that was probably my nervous, oh my God, it was kind of like, oh. And so I had this elaborate thing, and I'm like, ha ha ha, I can drink aconite. Well, it was Roy Upton had once described the symptoms of aconite poisoning to me. And he's a Western herbalist who does all of the monographs and does all the herbal safety stuff and so forth. Brilliant guy. And it's actually pleasant if it's this warm, tingly numbness that'll start at your feet. It starts to come up, and when it hits your chest, your heart and lungs, they'll stop and you'll be dead. And so as I'm lecturing, there was a good 30 people in the audience. I start getting this warm, tingling sensation creeping up my legs. And there was a moment of panic. At least I didn't run into the woods. In my head, it was in my memory that ginger is an effective, ginger and licorice, I believe, are the antidotes, but ginger is one of the better antidotes. And I had just started stocking this really good, fresh freeze-dried capsule of ginger. So as part of the lecture, it was like, and if I had poisoned myself, I could easily, because of this great education that I have, take this ginger powder and immediately. And so I took 5 capsules and dumped them into my mouth and washed those down with water. And it all probably came just about my waist. And I felt it go back down again.
You did not stop the lecture.
I didn't stop the lecture. No, the show must go on.
I told you he never stopped talking. We don't.
So here's a shocker, wash your freaking hands. But the reality is we don't think about that. We do herb walks. There's poke that grows out here. I've got gelsemium that's growing out here. I'll pet some gelsemium. It's a deadly poison. It's compared to curare. I have touched so many toxic plants, and if you're not sure, if you want to say like, oh, I would never do that, well, stick your hands in cayenne pepper, and then don't wash. Get the powder, get it on your hands. Don't wash your hands for an hour. And rub your eyes and your nose, go pee. So, like, in this case, it was invisible. I didn't see the poison that I had been stroking this whole time and putting my hands in the water because I pulled out the aconite to show them as I drank this stuff. And it was so easy to poison myself. And so, for real, wash your hands. You're touching herbs, they're medicine. Wear gloves, wash your hands before, after harvesting, medicine making, formula making, like, oh my God, especially if they're poisoned, but maybe it's poison to you. Maybe it's just, you getting a different dosage, things like that. We have aconite at the clinic. But also when you're working with poisonous plants, good to know what the symptoms are. Good to know what the antidote is.
Okay, so
and
Bob,
to have poison control's phone number handy.
so Bob, I'm going to read it almost word for word.
Okay.
Michael's brought something up that is just amazingly smart, and we should talk about this. What he doesn't know, and I've told him, and what you guys don't know, is we do speak about this privately
Which Michael is
a
this?
lot.
It doesn't matter.
Yeah, I don't. I have to pull him up.
I only know a couple.
Okay, so for herbalists that are just starting out, I think it may be easy to take on clients that are above what they are able to handle.
Yeah.
To gain confidence through experience, or more often, we may do a discovery call. Things look manageable, and then a serious or complex issue we're not trained quite for comes up, but they paid for our session and travel to you, instilling confidence in you. Case manager, it just goes on to, like, you get the gist of what I'm saying. What are our thoughts on this? Would we choose to take them on or pay for a mentorship through AHG or pass? This is so important. I have so much to say about this.
Great question.
So hold on, I got to shrink it up a little bit so I can see it all. Or past teacher between sessions to come ready to teach sessions in these more difficult cases. But would it be ethical to continue helping them for their first session, or more appropriate to hand them off to a more senior herbalist? You can say anything
I was
you
going to
want.
say, I'm sure,
Can I speak on this a tiny bit?
Go for it, and I'll put my 2 cents worth in.
So I have so much
I
to
have
say
opinions.
to this, because my specialty when I'm taking clients is critical care of some really heavy things and 4th stage cancer care. And I was thrown into it because there was no one else. I only had a small amount of people that would even teach it at a senior position. And yet these people kept coming, and I needed to do something. We coach you that when you're going to get your registered herbalist, your RH for AHG, we coach you to be super expressive of your limitations, that it asks you, who do you refer out to? When do you know to go and get help? They're checking you. We understand that years of experience come with a lot of
screw ups, like what we're talking about.
And teaching, yeah. And so they encourage you to say, when would you refer out, and exactly who do you refer out to? Because what we're watching for, Bob's been on the board for deciding that. He's been on the committees for deciding your age. What we're watching for is, do you know your limitations, and are you not prideful enough that you would hand it off? So I have many answers to this question, one of which is it's very, very, very appropriate for you as a layman herbalist, but somebody that this client is comfortable with, for you to guide their care. So it's very appropriate for you to collate the other people they're seeing and then refer out to somebody when it is over your head. So you can say to them, well, I'm not experienced in this manner, but I'm happy to try to help you navigate through it. I would like you to consult with this other herbalist. And if they are not free to pay you both ways, you can reduce your fee. You can work with the other herbalist because you gave them like kind of for a kickback because you gave them a client, but it's super appropriate. We do it to each other. Like, we will trade clients out within each other because we know somebody has a strong suit, or I'll say straight up to somebody, I have never heard of that before. How does this manifest for you? And I'm going to need a couple weeks to figure this out. Are you still comfortable with me? If not, I'll find somebody that you are comfortable with. There is no shame in doing that. And it shows a great understanding of medicine being a practice. That other doctors are not willing to step in and do that is just such a fallacy. We have lots of people hurt because that's not going to be the case. It's super appropriate for you to do both. Take the client and refer out, as we do all together. And one of the things that I added back to him was, that's why we feel like our clinical experience is so necessary. We won't graduate somebody as a clinician unless they show full proficiency. By the time you guys get through our programs, you've been with us for several years in and out of us watching you and how you handle yourself with other people. And it's not that you have to know everything, it's that you have to understand what you don't know. That it's more important that you question and question and question and question and gain confidence, but within the boundaries of, I know my limitations, and so I'm safe. I don't have to worry about you. I have students who come to me all the time who we think are great practitioners that just will run us into the ground with what they prepared, how they're going to do it. Do we see any pitfalls? And I always say to them, you're not the one I'm worried about. I'm worried about the one who's never asked me a single question, because they think they know what's going on. And even a surgeon will tell you, the more that we know, the more we know things, we know that we know nothing. That the more that we go forward, that we're trying to learn, we're trying to reach further, trying to up what we already know, even with 40 years of experience. So the answer to his question is both. Like seeking professional help, knowing, understanding, gaining, working through it with the person so that they can gain the knowledge that they're missing when they refer out. Like there's many ways to handle it, and it shows such a strong practitioner that you know your limitation and need to refer out.
And I think every herbalist is actually confronted with that. So everything that Renee said, I agree with. And it's funny, and if you had a formal training, if you went to an herb school, you had a formal mentor in some form, I would hope that any of them would say, please consult me for you. Like if you're emailing us every time you treat somebody for cold or flu, I'm going to say, no, I ain't answering.
You got that, you can handle
But if it's the first time you've seen cancer or some crazy autoimmune thing or something, like all of our graduates, I think at some point go, hey, this is, and if they just say, what should I do?
Nope.
No, then I don't know why we graduated you. But if you go, here's what I'm thinking, this is what I see.
Tell me what I've
Do you
missed.
think this is a good idea? And
look over their blood
we
work.
might say, yeah, like, so what meds are they on? Yeah, go for it. You know, that's great. Maybe you should also throw in X. And all of us, like, I'm sorry, like I went to a 4-year master's degree, acupuncture school. I know cool stuff. And most of my other herbal training was informal. Like I don't have a Western herbal mentor per se. I have people I can contact if I felt stuck. And so I think it is the importance of some version of formal training. There are a number of people who, other herbalists, and I hate to say it, Renee and I actually tried to do this. We're just like, there aren't that many hours in the day, we can't do it. But there are a few people, Thomas Easley and a few others, who will, you have to pay them, but say, hey, if you got a case to run by me, like they'll review it for you. But
they'll make it worse.
Yeah. But I think
they'll add too much in.
It is what we hope that our clinical practice for our students provides. But I see when we go to the conference, we tell all of our students, go to the conferences, not because you're going to learn voluminous amounts of information and be brilliant.
You see what
you'll actually see that you're a better herbalist as a first-year student than most of the herbalists that are at that conference. Not all, but most. And so we sit around and we're like, people are seeing, you know, they're like, wow, you guys will actually work on something with fibromyalgia and chronic fatigue syndrome? And we're like, there.
5 times a day.
And they don't know how to approach it because they haven't had clinical experience and they're too frightened to go into clinical experience. And so part of it, we don't want to have a false bravado and go into things foolishly, but to recognize if you have a system to understand imbalances. And for us, we talk about energetics. And that allows us to understand the nature of disease in a way different from trying to analyze endocrinology. Like, oh my God, nobody understands that. And so whatever system you have, and there are many, to recognizing and trusting that system. So learn it to its as much depth as you can. Trust in that system. And then just like we were talking about earlier, low and slow. And it's funny, like I've had some crazy complex cases that on the whole I've had really good success with, but it was just a year ago I had the hardest case I've ever had. And I literally, there was a moment where I was like, I don't know whether I should even take this case on. She had breast cancer, HIV, and was on kidney dialysis 3 times a week. And then turned out to also have congestive heart failure. All at the same time. And she wanted herbs, not acupuncture. And I was like, it's going to take me a little while. Because, you know, that was over everybody's head. I don't care who you are. That was like, I took 2 weeks to find anything that I thought would do her any good. And actually, we had great success. You don't come off of dialysis, but was able to advise her on a variety of issues. I could work on her diet, and ultimately, I found herbs that were safe to do with dialysis, with all the other treatments that she was going through, and walked her through that whole process of mastectomy. I don't think she did radiation. I think she just did a mastectomy, and improved her HIV numbers and improved her kidney dialysis numbers. And with like, I could only find 5 herbs that matched her pattern that were safe with that. And it was still terrifying. It continues to be terrifying. I see her occasionally.
Let me add a little bit because we're talking back and forth, and I
Yeah.
would like to have a conversation with him, like other than this. One of the things he was saying is like the ethical side around that. Like we have herbalists, and I will tell you. So Michael, to that account, today, yeah, I think it was today. It might have been yesterday. I'm not going to say who it is for the reason. I had 2 upper herbalists, one upper herbalist, who is a clinician and has a school, has published books. I had them contacting us to send people to us with very normal things. And I questioned it slightly and said, yeah, sure. Like I'll take them, but what's going on? Like, why? And they said, honestly, we just really don't know what to do with this. And I'm like, huh. And so like I turned to Bob and said, like, does this sound right to you? I mean, like, I'm glad, I'm fine that somebody wants to do that. Like, that's okay. We'll help anybody. But my point is, it goes back to what Bob was saying is when you're first starting out, you don't realize actually how much you do know. And we glorify these authors and the people that speak out at conferences. And what everybody doesn't understand is if you know this person's name, they're not working. That if you see their faces and you know their name, they don't have clinic hours because our heads are down and they're in the trenches. It's all the people you don't know that are actually taking clients, that are actually seeing people. So a lot of times we get really good teachers and really good information in books from people who never see the volume of people that go through the clinic or go through our students. And it's a huge juxtapose because I was shocked. This has just happened a day ago that this person was saying, I don't know what to do with this. Can you help with this? And I'm like, what do you mean you don't know what to do with this? You're pumping out students. You better know what to do with this. They are very common ailments. And so it was one of those things. So what he's saying is, what's the ethicalness of it? I think it comes with honesty, and that you just let them know that this is a challenge that I'm happy to go through with you if you're confident enough to do that. And if not, I'm happy to stand with you through it with a referral as well, and to help you understand what's going on if you're not as comfortable with that person. It's very, very normal for us to get consulting fees. And so it's normal for you to get a consulting fee so that we help to collate all of the care from all the holistic practitioners. And what I didn't say is that I'm a traditional healer too. So that even goes for traditional things like limpias or chakra cleansings or whatever the crazy holistic thing is that you're going for, leech therapy that day. I'm happy to advise on it. If you trusted me, I will do the research and help you pull that in. There's nothing wrong with that. That's not unethical. Just be as transparent as possible, but also let's find a way to gain confidence for what you do know, because you being able to read blood work is such a huge plus. And so we teach that, and people are very scared of that. And so helping with knowing the drug interactions and stuff like that, that's a good thing.
And so it's not wrong. Like
it's not unethical.
If you're a single person who doesn't like children,
and
somebody brings an infant into you, and it's okay to go, I am not the right person and not charge them. And I've given people an out if I happen to love kids and working on them is super
We
easy.
do this in clinic though. We
but-
let people out if they don't want dogs,
Yeah.
if they don't want babies, we let them
Eh,
change it
But
around.
in the same sense, and it's exactly what Renee said, just be honest. The woman who came in with the HIV, kidney failure, blah, 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 all that. I literally, as I sat there and went, huh. I was like, I've seen each one of these individually.
But together,
I have never seen that. It's not even a trifecta. That's a quadruple fecta, whatever the hell that is. I was like, I don't know if I can help you,
I don't know if any doctor
but
is
I will.
prepared.
Right. And so I said, I will do my best.
And that's more than we get from physicians. The physicians that took care of each of those ailments would have broken them
Yeah.
up and not been and said, sorry,
Yeah.
you'll have to go to
And-
that one for that. Yeah.
And I've many times said to folks exactly what Renee said. It was like, I'm going to use Chinese medicine. I'm going to use energetics. I've never actually even heard that disease. They're like, yeah, if you told me you had, I would have called you a liar.
Yeah.
Because it was such a rare disease. It's okay to be honest. It's okay. I just had an acupuncturist who saw me recently.
Right.
And it was something where I felt like I was not the best person. And literally I heard Renee's voice out in the clinic and I was like, can I have your permission to bring her into the room? Because I thought Renee would do a better job than I did for what this woman was dealing with. And she thanked me for doing that. And, and Renee did. She had way more advice. It was more appropriate for her to speak to this woman than I was for the particular issue. So it's like, no, it's recognizing your limitations, being honest with your client, and do the best you can.
And this is something you just brought up, something that I was going to say that I don't think people realize. I don't think you guys realize. I don't think the new students realize. And that in the world, we're actually a very small group. And the higher up people, the authors of the books that we give you, all the people you see lecture at the conferences are us and our friends. And it's a very small group. And what you guys don't know is we are constantly asking each other for help. That we have these private forums that are just only clinicians, where doctors are going on those forums and saying to us, do you know what to do with this? We've never seen this. We don't know what to do with this. Or we've thrown all of our medical care at this and we don't know what to do with this. And as herbalists, we argue it out. And the one that feels like they're the strongest at it goes for it.
It frequently involves wine.
Yes, yeah. And so we do this. And so you guys don't know that we're constantly questioning ourselves because illnesses are variable. Humans are variable. The medicine, when you harvest it, is variable. How you make it is like all those things are sliding scales. So we are constantly doing that. It's when you have the ego state, the fact that he's even asking that question means that he is in the right ego state for this of, I constantly need more knowledge. I constantly need to be reaching up. I'm checking every single dotting, every I, crossing every T. And so it's very ethical to have this process in front of a client as well. They should only expect what you can give, and then you'll help with the reference out. Also, we ask each other for help all the time.
And I will say, but also, if you've had formal training, if sorry, I think our students are the best. Yay.
They're pretty good.
And
we put them through the gauntlet.
There is, and I don't care whether you're an acupuncture physician, MD, all of them. They haven't seen everything. No. None of us have. And the first 5 years, you literally are faking it until you make it. And that doesn't mean lying or deluding your patients or clients. It means like
faking the confidence.
I'm smart. I know where to look crap up. I'll get back to you with that. And it might take a week or two.
I still cry over clients.
And so like, trust yourself. If you're going in with the premise of helping somebody and that know that you'll do the very best possible.
Yeah.
And it may be as simple as like, I'm going to encourage them to drink more water. I'm going to have them eat a vegetable.
I tell them that too.
That's more benefit than they got from
you
their
can
MD.
Always do something. What can you do? You can always support this person in some way. What do you know?
Nettles.
Yeah, and then the rest, no, because nettles is going to kill some people. Like you live in Colorado, you're going to turn into dust and fall on the ground. So absolutely, we can always help in some way.
It's funny, our student clinic right now, it's kind of a hodgepodge because we kind of spread people out over 3 days. So all of our, I shouldn't say that. Some of our interns are actually already graduated, but we're still letting them stay in and see clients. But a lot of our Western and we're starting to see our Chinese they're brand new. They may be seeing their first client or two, and they are completely panicked. And we're like, nope, just go in there, ask the questions, come up with the best you can. And, it literally, even though they're stumbling over the questions, they're afraid to make eye contact, they have no idea what they're doing with the pulse. The reality is, more often than not, that client, their first time ever seeing an herbalist with these complete novices of our students, they're coming out going, that's the most thorough medical intake I've ever had. Thank you so much for spending so much time. I feel like I learned a lot. And like, no doctor has ever heard that in the 7-minute intake, which is the norm. That's average. And so whether or not we do them any good, they appreciate the effort. And as long as we didn't do harm, and if the best we did was say, go for a walk, drink some water, and check out a veggie once in a while, that will have benefit. And so like we do as much as, I'm not a great body worker. And so, I'll refer somebody out to a massage therapist. I'm lazy too, but massage is hard work.
But one for one, even in the herbal realm, there's people who are suited. Like you just have a niche with the stomach stuff because you've dealt with it a lot. You have a really good.
It's like, my specialty because
I'll give it to you any day. I do not want to deal with it. Like I'll be like, Bob can do it. And so that it's a great thing to bring up. The ethics of all of it is a great thing to bring up. But always remembering that you're in it because you want to help somebody. And so that in itself, what can you do? Being very transparent. I remind our herbalists that most starting out herbalists have a single client every 2 weeks. Because you're staggering them and you're taking 2 weeks to complete and think and study and make their formula. Not like us when we make the formula that night and pump it out. And like, no, it's very normal to have these.
I know we have a lot of our Chinese and Western students around here right now. So for those of you who've taken barefoot doctoring,
we put you through the fire, man.
A lot of the things that are in the barefoot doctoring class are from my first 5 patients when I was in acupuncture school, that I took weeks to create recipes and do research and find things that I thought were appropriate. And literally it took me that long just to put together stuff for them. And because I was using food primarily, like, hey, here's the herb formula, great, here's the pokey things I'm going to stick in you, but how do I coach people? And so I literally banged my head against, and it was pre-internet pretty much. I guess there was some internet, but it was like, no, that's good that you only have one a week or one every 2 weeks, because like you're going to put all of that thought and effort into that human. When you're seeing 20 people a week, 30 people a week, you're like, oh my God, just here, get out, next. So it's good to take that time and effort. And if you do it right that first few times, you can literally use those things for the rest of your career, because good research doesn't change a whole lot.
That was what Ruthie said when I told her she could like to come this class. I told her you could tell them anything you wanted. Do you guys want to ask something of her? And they said, well, what's one thing that you would do differently? And she said, from the beginning, write down every single formula, like make excruciating notes, because in the beginning she had good successes and she's like, oh, I remember that whole energetic patterning. What was that thing I did? And so yeah, I mean, these are great things to bring up, though. I'm glad that he's thinking about it.
All right, it's 8:30. We're gonna let you guys go enjoy your weekend. I think it's Friday. I don't even know. Yay, Herb Day's coming up. Lots of other cool stuff. At least see you guys at Herb Day.
Herb Day's amazing. And just,
I'm sure we should be wrapping this up with something profound, but I'm just
contact us if there's anything that you need, if you have questions about what you heard tonight, or any questions about any of the other upcoming classes, or want to contact us for refer a client if you needed anything that you needed. Just let us know. You guys all know it's easy to get in contact with us. We have stuff that's coming up, and have a good weekend. Like this is a holiday weekend for many people. So
yeah, we're gonna go enjoy ourselves. We're going canoeing.
Yep. We're gonna,
Yes, we'll
well,
be
we have
rested
to,
toasted.
yeah, we have to get ready for taking our student, we take our students wildcrafting, so we need to take a look, so.
Yeah, so we
All right.
actually have to scout the river ahead of time.
Thank you.
No problem.
Good night, all. Thank you all.
Yeah, have fun.
Thank
See
you.
y'all on Herb Day, I hope, if we don't see you before then.
Yeah,
Thank you so much.
thank you, thank you.
And I'll probably post this on YouTube in a couple of days. I just signed Larissa in just in time to shut her down.
Sign them off.
All right. Da, da, da. Good night, all. I'm gonna go bust you off of here. End meeting for all.